Good morning, everyone. Good morning, Pri. Good morning, Zhu. And good morning, everyone. We're starting now our last day of our FIS week, the last day of the biggest experience in healthcare in Latin America. That's right. We're coming to an end with a wonderful week full of content. And today we have wonderful panels going on. And as you know, it's three simultaneous event. FIS 21, the biggest event for leaderships in Latin America. Symmetria, the first ESG event in the healthcare sector in Latin America. And company meetings where companies present special content only. It's worth mentioning that we have an augmented reality app and a virtual reality app. If you want to download it, just go to your app store and download FIS Week. You're going to be able to visit ancient monuments in Rome and other places, in addition to watching our discussions. That's right. And all that is happening inside Trust, the social network where healthcare gets connected. And you're going to get connected to all of our sponsors and speakers. Are you ready? So let's get started with our last day. The first panel is about the epidemiological base for management of population health. And it will be moderated by Carlos Marinelli, head of Atlantica Hospitals and Grupo Bradesco Seguros, as well as Julio Croda, infectologist, researcher at Fiocruz, and a professor at UFMS, Miguel Lago, executive director at the IEPS, and Dr. Renato Veras, a medical doctor and director of the Open University of the Third Age. And please don't miss out. Follow our initiatives on social media and share your experience by using the hashtag FISWeek. And please tag us so that we can repost your publications. Are you ready? So let's get started with our last day. Good morning and welcome to yet another panel at FIS Week 21. It's an honor to participate in this edition. I'd like to congratulate Jose Villar. We're starting this panel about the epidemiology base for managing populational health. We have our colleagues with us, Dr. Julia Croda, infectologist and researcher at Fiocruz, and a professor at UFMS, Miguel Lago, executive director at IEPS, and Renato Veras, medical director at the Open University of UERJ. Epidemiology refers to the study of people, or the study of what happens with the population. According to the Oxford University Press Dictionary, epidemiology is the study of distribution and determinants or events related to health in specific populations, and the application of that study for controlling health problems. Maybe its precise definition is not as alive in your head as it should be, but the practical application of epidemiology is more present than ever. Population studies, vaccine coverage, at-risk populations, syndromes, and a series of elements that are recurring in the media and that go way beyond scientific explanation. Epidemiology includes the study of sequence, patterns, causes, or events related to the health of populations, and the application of this study to deal with population health problems. In a country as big as Brazil, this study is fundamental as a strategy for managing the healthcare of populations from different origins and different contexts. It's a key practice to establish diagnosis, planning actions, and guaranteeing the distribution of resources to care for the health of a certain population. Thus, epidemiologists examine the occurrence of diseases and impacts on populations using cohort studies and cause and control to assess that. Basic specific knowledge about the occurrence and dissemination of disease in a population is essential to implement effective measures for control and prevention. To get us started in the conversation, I want to invite Dr. Julio Croda for his initial words. You have the floor, Dr. Julio. Good morning, everyone watching us at FIS Week. It's a pleasure to be with such a large audience from several different industries in our society to deal about the subject that's not usually approached in this type of meeting, but one that's fundamental if we want to understand what occurred with COVID-19 and what we can expect for the future. Epidemiology is where we can somehow think about society, propose more effective prevention measures, especially to deal with infectious diseases, but also chronic diseases. So it's important that we bear in mind that without high quality education, there is no high quality treatment, there is no adequate control, there's no adequate preventative proposals, and you cannot work with population health. The epidemiological concept of several diseases leads us to think about the best interventions, the most effective treatments for that specific population, always taking into account the geographic location. We use epidemiology every day in our routine. For instance, the budget that's allocated to each state is based on the IBGE census that collects information about the number of residents in each city, their social economic characteristics in terms of income, age distribution, distribution by sex, and diseases that can be found in that population, such as the prevalence of diabetes, hypertension. Our census has been delayed. It should happen every 10 years. And without the census, we could be blind to understanding the population flows that occurred in our country. For instance, the growth of certain cities and regions, the need to organize healthcare services that are necessary to cater to the needs of that population. And if there's been a change to the population profile in terms of income, age range, distribution by sex, and level of education. So we're lagging behind in this census, which is a reason for concern because we use it a lot for our daily activities as epidemiologists, because it gives us this scenario about the population, not only in terms of demography, but also in terms of healthcare elements that are essential for healthcare managers, both public and private, to make their best decisions. Brazil is a huge country with different realities, different healthcare hurdles. We know very little of Brazil, and therefore we waste many public and private resources because we're not able to plan adequately. We're not able to accurately define the reality of each location, and that somehow leaves us blind. And we've been using the census, which is very important for that, the IBGE census. We have to advance in terms of understanding some health aspects that are not found in the census. And that's why we talk about health surveillance that encompasses several sectors, one of them being epidemiological surveillance that generates information about diseases and about understanding the concentration of diseases in the territory and of proposing more cost-effective treatments. We clearly experienced the moment in Brazil where epidemiology showed its basis. And we that work in epidemiology, we understand why some scenarios occurred during the COVID-19 pandemic. And we could see during the pandemic that some cities were most affected, others not so much. Some states had a greater impact due to the pandemic, greater mortality, higher need of hospital facilities. And why does that happen? A clear example is the distribution of treatment beds in Brazil. There's a scarcity of that, especially in the north of Brazil. There is a scarcity of medical professionals and healthcare professionals in the north of Brazil, which somehow leads to an unequal offer of healthcare services and treatments, and somehow also leads to a consequence. The consequence of the COVID-19 pandemic was the tragedy that we saw across many states in the north, and more specifically Manaus. Everybody remembers what happened in Manaus, and that was not by chance that that tragedy happened. And the epidemiology can explain that. It's a city with low coverage of primary care, with a few intensive therapy beds, both in the public and private network. So it's not only a matter of poor management, but also in terms of the conditions that led to this chaos in the city of Manaus due to lack of infrastructure. When you compare it with states in the south, especially São Paulo, there's a relevant offer of hospital beds, and there was no shortage of these hospital beds, and therefore the management of the crisis management was more adequate, and some activities could be limited. You can have an impact, a lower impact on the economy. So it's really important to understand that epidemiology is the basis of everything, and that we have to get ready for the future. We have to get ready for new pandemics, and also to get ready for demographic changes that are going to happen in Brazil. Aging, increase in chronic diseases. These data are produced by epidemiology. Epidemiology is highly connected with geography. It requires understanding the context of population health, and both public and private sector administrators have to understand its reality and offer more adequate healthcare services for that reality, for that context, and always with the view at the striking regional differences in Brazil. If we look at Brazil as a country, we'll understand that Brazil fits inside Europe, or actually vice versa, and differences are really striking, and we can understand why the microencephalus cases caused by Zika were especially found in the Northeast, and we'll understand why there's a huge increase of HIV and TB in the South, why the yellow fever virus was able to migrate from the North to the South and Southeast currently, and how we can propose intervention measures. Vaccination was what occurred with yellow fever. As the virus migrated through different regions, the offer of vaccines increased, and now everybody living in the south of Brazil has to take the yellow fever vaccine. So I think that Brazil has a robust system, which is the universal health system in Brazil, which is found across the entire country. We know that this system offers primary care to private services of healthcare. You have to notify any diseases, but it is also necessary to invest more in the intelligence of the system, especially in its fluidity and its immediate response in terms of generating data, in terms of generating evidence, not only to report, but to make better decisions and to generate treatment, and especially to assess these interventions, these treatments, if they're timely. We have a lot of difficulty with the universal health system in Brazil, the public health system, and also the private healthcare system. We have a difficulty in assessing preventative measures in the healthcare, treatments, basic sanitation, vaccines, which are to other industries, but that are highly prevalent in health, such as access to minimum income. So there is a lot of discussion, and healthcare surveillance involves the basis of epidemiology, and it's the most modern way for us to discuss population intelligence in health. There are fundamental tools to contain new pandemics. And we've experienced a COVID-19 pandemic that was disastrous, with a huge impact on health, with a huge impact on our economy. And we could have done better if we had used more adequately the epidemiological data in terms of proposing more adequate interventions, understanding each scenario of the epidemiology, each social context that we find, and these differences that we find in Brazil. So we could discuss in this scenario the availability of diagnostic tests for COVID, the availability of intensive care hospital beds, to understand that in some regions there's lower vaccine coverage, and what are the reasons for that, and how we could we have to offer. There's a need for a vaccination passport in some regions because the population is more, it tends to reject vaccination. So, well, I could keep on going, but there are other speakers. I'll give the floor to them. I will focus more on the epidemiological basis in their relationship with infectious diseases, but we can also discuss management and how epidemiology can contribute to administration. Thank you. Miguel, over to you. Thank you. It's really an honor to be here. I want to thank FIS for the invitation. I want to thank my fellow panelists, both Carlos, Dr. Julio, Dr. Renato. It will be hard to talk about epidemiology with Dr. Julio, but anyway, they're the specialists. But I think that a few things that, adding to what Julio said, one thing he mentioned was that the poor quality of our response to the pandemic was due to the fact that we were not necessarily using epidemiological bases as guidance for this response. And that's true. And I think that an even more important element has to be highlighted. Brazil developed, over the course of the last 20 or 30 years, one of the biggest programs in healthcare, and the family health strategy is a model recommended by the OECD, which is a club of rich countries that Brazil dreams of joining. But when it makes recommendations about public health, it includes the family health strategy as an example. And in that strategy, we have over 300,000 community agents spread across the country that have the trust of the community that they treat. And that's one of the most important elements of public health: the trust of patients, the trust of the population in those professionals. And it was not used adequately as a source of epidemiological surveillance. Back then, of course, it was very hard to do testing, and Brazil fell in the trap of global inequalities. So our testing capacity was impacted, and there was a series of problems. But we had this extraordinary structure that was not used, at least it was not as used as it should be, to identify and reinforce certain messages, and therefore take on this role of being responsible for epidemiological surveillance. So I think these are warnings for us. I think we can do a better epidemiological surveillance than we've been doing right now, because we have an extraordinary basis. Having such a prevalent system is not found anywhere. That's number one. The second thing is that the way healthcare is organized in Brazil, public healthcare management is organized, is based on a political standpoint, much more than an epidemiological perspective. The way the public health system was set up in the Constitution gave a lot of flexibility to municipalities. We have over 5,000 municipalities in Brazil, and municipalities are guided much more by their mayors and their political stimuli in terms of building hospital or delivering healthcare facilities that could lead to a high number of votes, and not necessarily what that municipality really needs. So a rationale of epidemiology and population health that is able really to organize the healthcare systems is necessary. And of course, we understand that certain things are desirable, but they're politically unfeasible. And that's a huge political fight, because municipalities will not give up on their autonomy. But it's increasingly more important that municipalities are coordinated with other municipalities to create and organize the healthcare system based on the needs of that population, and not based on a political rationale. This is a role that governors can take on. And Espírito Santo, when Ricardo Oliveira was the health secretary, was able to better organize the system, strengthening the regional healthcare facilities. And that's possible, but it requires hard work and political leadership. So I think my main message is that we should make good use of what we already have to provide for an even better epidemiological surveillance, and to base our healthcare policies on them, but also to think about how we can rethink the healthcare system, always based on the epidemiological base rather than the political and administrative base. That was my introduction. Thank you. Thank you. Thank you, Miguel. Dr. Renato, you have the floor. Well, first, I want to thank the FIS administration, my dear friend, Jose Villar. We worked together for many decades during PRONEP times. And well, I'll try to talk about the obvious, the extremely obvious things that should have been done, but we do the opposite. And that is necessary because this refers to the basis of a more effective system, and epidemiology is certainly fundamental. Well, my proposal is that we think about this in an absolutely simple manner, and everybody will agree with this. And hence my first question. We don't walk the talk, which is absurd. When we talk about essential healthcare models, Of course, the elderly group needs to be given the most importance because it's the fastest growing group in Brazil. We have a huge amount of elderlies in Brazil, and we know that that tends to increase more and more. If we think in a very simplistic manner, in a big room, on one side of the room, we place 100 people aged between 85 and 90. And on the other side, we put 100 people aged between 15 and 20 years of age. And if we ask anybody, a passerby on the street, a layperson, and we ask them, what's the more fragile group, the one on the left or the one on the right? People will say, well, of course, the older people, they're much more fragile. And that's true because the elderly people are more fragile. They have chronic diseases and more diseases. And why is that so? Let's imagine a heart beating 70 times per minute for 80 or 90 years. Of course, that heart is going to be weaker. And that information is found everywhere. So the healthcare model that we need to find, which, by the way, in terms of healthcare models, broadly speaking, we have two big models, the American model of fragmentation and hospitals, or the British model from 1948, where there's this rationale of a GP and the physician will be the coordinator with his portfolio of clients. But when the population ages, it's even more important to coordinate care because you are there's a certainty that those people will develop a number of chronic diseases. So for that, you need to be based on a totally different rationale than the one that we adopt. We cannot have the emergency room as the entry door into the system. You cannot have a customer with 4, 5, or 6 physicians because he or she is a lay person. Well, I have pain in my arm or a cardiovascular problem. It could be a lung problem or a liver problem. So they start looking for physicians, whether it is in the public healthcare system or in the private healthcare system. And that is absurd. Because we should not agree with that. And especially due to the low quality of healthcare and its inefficiency and its high costs, our healthcare system could be much better and much cheaper, taking better care of people, and especially the population that we know that will develop chronic diseases if we had, for instance, epidemiology tools, the screenings, which are highly accurate in terms of identification of 85, 90%. That's almost the same as physicians. But anyway, we do have simple tools, and we should have medical records that are much more intelligent and that are based on a follow-up methodology. A medical record cannot only talk about pathology. That person, do they live in a community? They have their family members. There's emotional aspects, nutritional aspects. There's rehabilitation that's required for the elderly. And that's why we work with gerontologists, the nurses and psychiatrists, so actually psychologists and nutritionists. I mean, it's a team which is what I call the light healthcare team. People that by caring for a certain healthcare portfolio, they get very good results due to the support that they give to that population. And actually, more than that, the support they give allows you to increase essential care and reduce costs. You can, for instance, have an average in a population of 7% of hospitalizations and the cost of this population group that consumes around 60 or 65% of healthcare costs at a hospital, you can bring it down to 40% and have much more money to invest in lightweight healthcare with basic care, follow up, and use less this group of specialists, or as I said, to use less the hospital as the basis of the system. I am a physician. I am a professor. I've been doing this for a long time, so I'm not criticizing my colleagues. I'm not criticizing physicians. However, the excessive use of specialists is bad, and it's bad because you have a group of physicians and they prescribe drugs and they prescribe tests, and that's not kept in one single medical record. Each physician has their own computer. It's actually modern typewriters that people have, right? And they do not communicate between each other. So having a medical record that is really intelligent and that can be used by a healthcare system where the GP, the family physician, the generalist that coordinates the system, and if necessary, of course, they'll refer the patient to a specialist, but the patient will come back to the medical appointment, and that will be recorded in the medical record. The family has a fundamental role. When it comes to the elderly, we have to talk about the family and the people around that elderly, the people who are protecting them, and the people who are coordinating care at home as a routine, activities involving participation, new information. I mean, at the university where the project was created 20 years ago, it received an award by the WHO because we take on a very broad perspective and the need to produce science. I'm also an editor in a journal, one of the most important journals in Brazil in gerontology. So we need to find solutions that are absolutely different when it comes to our specificities. And the myth that elderly people are costly, well, they're costly because the model is bad. It's too fragmented. It's a model of high intervention and a few results. So these things, I would like to bring them to the table and place the epidemiology at the center of the stage, as well as the medical records and the way we follow up on patients and the lightweight care, as I call it, in the role of a healthcare team, not necessarily physicians.
Yeah, and I work with ANF, and Marta Oliveira, actually, who was director and so on and so forth. Marta was my PhD student, and it was all very interesting for the agency. We carried out a project defining the basis for the model that we thought was the best one. 118 companies participated. And then we had a selection, and as amazing as it may sound, very few had a model. For example, the old model in England where there is a manager that conducts everything with a well-qualified physician who's a well-trained. I'm not even getting to the details of other important aspects for the success, but I just wanted to show you that we are a bit schizophrenic. We say something and we practice something else. I don't know of any manager, and I know a lot of them, they all assure that in my system, I do have team management. We're all in favor of prevention, promotion of healthcare, of having a physician in charge. But then when you check it, unfortunately, that's not how it works. And so this is something I would like to reinforce. Aging is an issue. We're not going to go back in time. Brazil is no longer the country of the world. The whole world is aging. Our practices have to change. And we here in Brazil have to change our healthcare model. It's inefficient, and for the elderly, it is totally not qualified. We have a lot of chronic diseases, and the elderly end up being a problem for their families. We all want to live longer, but we want to live longer and healthier. If you're older than 80 and you have to go to the doctors every day carrying out tests and with 100 physicians at very high costs, that's exactly what we have to eliminate. I apologize for being so enthusiastic about this, but because I've been dealing with this aging issue for a while now, and something that I created some 20, 80 years ago, and we have the WHO with its guidelines, and we do a lot of things together with other countries. And so just to wrap up, I wanted to say that in the Netherlands, and Martha is carrying out a project here in Brazil. It's called LASCO. She's even considering not having a doctor. I think that's perhaps a bit too radical, but we have to keep in mind that coordination is important. Care is very important. The families must be incorporated. A whole bunch of things that we don't do here. I apologize for taking more than my 10 minutes, and let's move on to the Q&A. I have encouraged questions, so let's move on. This is it for now. Excellent, Dr. Renato, and the energy and your excitement actually are both very important, because to have changes, we do need all of that energy. Let's move on to the Q&A. I would like to suggest that we start with Dr. Julio. You talked about what we experienced during the pandemic. You talked about the tragedy in the north of Brazil. And epidemiology can explain why it happened in the north region. My question is, will we be able to avoid a second tragedy with a new pandemic or a new situation like that? And also, what do we need to do that? Carlos, that's an excellent question. Thank you for the opportunity and the time to be able to clarify this specific topic. Now that we have effective mass vaccination, the population is complying, we are accelerating. Rio has an extremely high vaccine coverage in all age groups. We will be able to obtain vaccine coverage and obtain better results, but we have to define what was right and wrong. We should not have a political debate. The responsibility to manage this crisis is ours. Epidemiology is the basis, and it will help us understand why we had this tragedy, what are the indicators that justify it, and how we can better prepare for the future. In Brazil, we have a very good system. Our public healthcare system is wonderful. It is widespread. We also have healthcare services. We have quality data, actually. The US, for example, it's difficult for them to obtain data related to epidemiology and the number of cases and deaths and vaccination, because each state has a different notification system. And so it's difficult for them to generate combined data and to analyze information more substantially. We do have an advantage. We have a robust and strong system. We have good notification as well. We may have some underreporting, of course, but hospitalization and death, which is something that we used using SIM and two national systems actually. Every hospitalized patient must be notified, and every patient who dies need a death certificate. So we do not have underreporting for deaths as opposed to Mexico. They have over 50% of underreporting on the number of deaths. India too. We have a good information system. What we lack is a good strategy system to deal with emergencies in public health care. Our surveillance model, both at the level of healthcare surveillance, which means epidemiology for managers at a local, state, and federal level, do not use a lot of intelligence and do not use current tools such as math modeling to anticipate future situations, to understand the impact of an economic crisis, which is what we're going through now, to propose interventions, and to monitor by means of epidemiology and healthcare. Oftentimes, local managers want to expand their program, for example, to test tuberculosis. Great, wonderful. It's a disease that is concentrated in the more vulnerable population. So what do? They do not understand that in some towns, the main population are perhaps those who, the inmates. So we generate data, and in this case, we have a lot of cases of tuberculosis, dengue fever, and so if you have an approach which is related to the local reality because you haven't used epidemiology to evaluate that and understand what is the best intervention, and you waste money and you don't reach your objective. Historically, our public healthcare system has always had good data collection, notification. Somehow we can monitor diseases, but we need to evolve. We know that some countries that have a strong healthcare service have evolved with their intelligence system. Every week we have reports with math models, robust analysis, where interventions are proposed to the government. Here for us, it is difficult to act based on intelligence. Perfect. Thank you, Dr. Julio. Also, adding to your comments, what you said about moving on with intelligence, I'm going to link it to what Miguel said. We have to change the way we analyze investments in healthcare. We have to change that to an epidemiologic basis. I asked Miguel, what kinds of incentives should we have in place? And he was talking about what happened in the state of Espírito Santo. So what can we do to have better incentives so that this intelligence-based information is used more effectively, and above all, in a proactive manner, not only to explain what happened, but to act so that we can avoid degrading situations. Thank you for your question. Espírito Santo did it by using leadership. We had a good communication process among the different parties in the different cities, and the state government always has its own budget. I know that one of their strategies was to locate or find and then distribute healthcare equipment so that all of these different regions could be better organized. And this is something that could happen with the state level governments, but we must have budget in place. I would like to remind you that our public healthcare system is the most ambitious healthcare system in the world because we have a very large population and offer free of charge. We offer healthcare free of charge. And we compare our data, Brazil invests 3.8% of its GDP in healthcare. This is almost nothing. It's a little bit more than Venezuela. And so if you consider Spain, for example, they spend over 7% of their GDP. And France, for example, has a better system than the UK. Their population is smaller, but they truly give a value in it. So we always have to consider how we're going to fund our public health care. And this is a chronic problem we have actually. Very good. Thank you, Miguel. Dr. Veras, regarding the traps or the problems we have in our current system, you mentioned some specific examples and the incentives we have today, taking into account hospitals, and sometimes they do not provide adequate follow-up to the patient. So how do you see this? And also using what happens in geriatrics. So what worries you the most about our current system and about our current incentives? Carlos, what worries me the most, and I'm not going to start from scratch, otherwise I would need 3 hours. But let's talk a little bit about intelligence, for example. Information is essential. That is why we in public health care and those who deal with collective aging, as we like to call it, that's why we are so concerned about the patient report. So let's consider a patient with 3 or 4 chronic diseases, and they go to their doctors 5 or 6 times per month. So how many reports do you think these patients have? Hundreds of them. This is 2021. This is absurd. Technology is there. It's so basic. So we must have intelligence available to us so that we can take care of these actions that are quite simple actually, but we need to have some logic in place. We need to start dealing with this issue really. And another important factor is that we're talking about this as if it was something so obvious, but if it's so obvious, why don't you do it? We have an old model, outdated, and it is something that was created way back then, and it's not an efficient model. It's impossible for you to hope that people will change something that they have practiced throughout their lives. I, for example, when I have consultancy and I create healthcare models, I will say, well, I want a doctor who has had a degree for at least 5 years. But I also do not want to have anybody who's had a degree for 30 years. Sometimes they are wonderful pneumologists or cardiologists, but they no longer have an overall view and will not include the correct team of doctors around them. People cannot think simply. If we know that most people, when they are as of 15 years of age, they will have chronic diseases, the same way that, nobody has a half of a disease. A woman cannot be half pregnant. So when we have a chronic disease in place, if we do not do anything about it, we can rest assured that it will get worse. And the problem is that we're talking about multiple chronic diseases. We're not talking about a single disease. So if we use a system where you have your own doctor who follows up the patient with all of the information required using epidemiology and with an intelligent medical record, with that alone, you can reduce costs significantly. You decrease hospitalization and hospitalization time, and you can offer better care, not only for the patient, but for the patient's lives, for the patient's social group. When we have outpatient projects, I had my PhD in England. So there are areas where we're not talking about patient visits only. We have lectures. It's almost like a healthcare club where everything is done in a pleasant manner. That's where you establish relationships, emotional relationships or relationships based on knowledge, and also in European countries where you have the winter time where all of the outpatient wards could be empty. It's the other way around. People go there, they receive meals there. So we have to conceive healthcare in a broader way. It is very expensive for a country to leave a huge population like we have, who are older than 50 years of age, a lot of them in a hospital bed, suffering with a lot of problems for their families. So like I said, getting to be 90 years of age nowadays is relatively easy, but we don't want people to suffer for 40 years after they are 50 years of age. And so to wrap up my intervention here, I wanted to reinforce. I have dear friends who work with healthcare, people who mean well. They say they practice in their companies, or sometimes they're even directors in different sectors of our public health care. They say they practice modern medicine. Well, it's a big lie. We are outdated. We we still use a lot of drugs, a lot of specialists, and a lot of testing. Once again, I'm not against a hospital. I'm not against the specialists. I am against excess and the inefficiency brought about our model. And the worst of all is that as our elderly population grows, we know the next year things are going to be worse than they are now. And I will stop here. Perfect, Dr. Renato. Okay, so let's talk to the audience. I have two questions, actually. We still have a lot of inefficiency. So how can we overcome this barrier? Also, COVID-19 infections, a new wave has started in England, and how are we going to face that? Well, it's important to characterize, and I will start with the second one because the first one is part of the consequence of the second question. So whenever we look at Europe, we can see Germany, for example, they have a vaccine coverage of 68. And here in Brazil, we have similar dates. The first dose is 76 or 77%. So in terms of the first dose, we're doing better than Germany, but in terms of the second dose, we are behind them. Whenever we talk about Germany, we have Austria and neighboring countries that have a low coverage. And then when we look at the Soviet Union and Russia, they also have low vaccine coverage. In this new European wave, we can divide countries into two groups. One where you have an increase in the number of cases, but there is an expressive number of increases in hospitalization, and that's when we have Spain, Portugal, and the UK, and we have other countries where the increase in the number of cases has had an increase in the number of deaths. The coverage is below 80%. And we know that in Eastern Europe and in the former Soviet Union, Russian, why is that happening? These countries do have vaccines available. They have bought their doses, and actually Russia produces the Sputnik and it has sold large amounts of doses to Latin America, but there is a lot of resistance to the vaccine. There is a strong anti-vax movement, and this is associated to the flexibilization of the preventive measures. The use of masks is no longer mandatory, but the increases in hospitalization, and that's with a higher impact on the society, which can somehow revert these measures that were made flexible because people do not believe in the vaccines, and because of the strong anti-vax movement, which was very strong in Russia, actually. And in these regions, this is done, or this happens because of a more totalitarian regimen. Here in Brazil, it's the other way around. We have had excellent vaccine coverage because in surveys carried out in the Americas, Brazilians accept the vaccine more. 94% of our population accepts the vaccine. And so we cannot allow any arguments against vaccine to be expanded. We have reached the situation in Brazil right now, not because of any governor, mayor, or the federal government. It is happening because our population is complying with the vaccination system, and some countries, or some people do not support mass vaccination. They say that if you get the vaccine, you will be transformed into an alligator and things like that. But I think it is very important to request a vaccine passport as it happened in Rio, but we have to improve our communication. The wealthy countries are being penalized by the lack of information or disinformation spread in the social media. In Brazil right now, in some point in time, part of the federal government, and it's sad to accept this reality and to understand it, but fortunately, the Brazilian population rejected that kind of argument, rejected the anti-vax movement. The population is being vaccinated and is complying with the mass vaccination system. That brings a lot of hope. We expect that it will continue like that. We hope to vaccinate our children, guarantee collective vaccination, that our companies can start working again. That is excellent, Dr. Julio. So we are about to wrap up right now. I will try to ask Miguel to quickly talk about something that you cannot say in 30 seconds, but I would like him to quickly answer this question. So how can we use a single basis with integrated medical information so that we can reduce waste and decrease our current expenses? Is this a matter of public health care? Yes, it is, and it's very important. It's important to have unified information systems that belong to the patients and not to the companies or the government. That's essential. However, that's difficult. It's difficult to implement it from a technical point of view and also from an administrative and political point of view. The US spent a lot of money with their urban management trying to unify their information system, and it didn't work out. Estonia also has a success case. Australia also is a success case, but their countries are much smaller. This question is perfect. We should try to get there. Very good. Okay, so we are only 20 seconds late, but we had a wonderful discussion. I would like to thank Dr. Croda, Lago, Veras, and Marinelli for participating. And I would also like to thank you for being here so that we can prepare ourselves for the future. I wish you a wonderful event, and I hope to see you in another opportunity. Thank you very much.
A Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força. A saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados. Unidos pela saúde.
O conhecimento transforma. A transformação te carrega para o futuro. Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
A Bradesco Saúde desenvolveu uma série de iniciativas que promovem orientação e cuidado em meio à pandemia de Covid-19. É o Saúde Digital. Com ele, quem tem Bradesco Saúde pode realizar consultas médicas por videochamada sem sair de casa. Veja como funciona. Para dúvidas e sintomas de Covid-19 ou outras questões de saúde, você deverá acessar o app Bradesco Saúde. Se você ainda não tem instalado, faça o download gratuito na App Store ou no Google Play. Para consultas médicas regulares com médicos referenciados, acesse o site bradescosaude.com.br. Confira as especialidades disponíveis para atendimento por videochamada e como agendar sua consulta. Bradesco Saúde, ao seu lado contra o coronavírus.
É pra ficar junto.
Inspira.
É pra saber sua história. É pro seu estilo de vida. É pra olhar nos olhos. É pra cada fase da vida. A DASA é uma rede de saúde integrada que acompanha as pessoas ao longo da vida. DASA é pra toda a vida.
Para ser referência em medicina, é preciso ir além. É preciso ciência, método de pesquisa, fomentar conhecimento, compartilhar e formar talentos. Ao longo do tempo, investimos para termos o melhor corpo médico, as melhores instalações, a melhor equipe assistencial, a tecnologia mais avançada. É nisso que acreditamos. É isso que buscamos. Somos o Hospital Moinhos de Vento. Referência em medicina, referência em saúde.
The body is an amazing organism designed to run marathons, think of ideas, and see a beautiful world. It's capable of complex tasks. But when the body is compromised by disease or disorders, disabled by trauma or wounds, it needs help getting better. And that's why we're here, to create medical technology that saves lives and changes lives. For the heart, the soul, the ambitions, and the dreams of every person we touch. We are here to innovate, to look at challenges from all angles, to follow patients beyond diagnosis, through treatment and recovery, to get them back to their best body, living their best lives, and being their best selves. Our ambitions are big. We are working to give people surgery without incisions, contact lenses that treat allergies, implants that monitor themselves, real-time maps of the heart. We are redefining what the body can accomplish. And even though we are a diverse group of businesses, we share a common goal: save lives and ignite all that's possible in every body.
Super-heróis são seres com poderes mágicos que voam, que enxergam o que ninguém enxerga. Hoje, fica claro que vivemos rodeados de super-heróis, dirigindo, acolhendo, cuidando, que têm feito da proteção do outro sua missão. Eles sempre estiveram aqui, só estavam disfarçados. Homenagem a quem tem feito mais do que seu trabalho para mais gente ficar bem. Mater Dei 40 anos.
Em 2021, o Prontuário Eletrônico do Paciente do SOMV, solução da empresa para o setor hospitalar, ganhou pela 6ª vez consecutiva o reconhecimento de melhor da América Latina, de acordo com o Instituto Norte-Americano CLES. Uma vitória que é nossa, de cada um que trabalha na MV. Quem faz o PEP sabe que por trás da solução tem muito esforço, dedicação e comprometimento. É por isso que esta conquista não é apenas da MV, é do Brasil, é nossa.
Nós nascemos na saúde e nos movemos pela saúde. Impulsionados por essa paixão, nos tornamos uma das maiores empresas de tecnologia para a saúde do Brasil. Nosso caminho é trilhado por 400 colaboradores e mais de 6.000 clientes. Somos tecnologia que evolui todos os dias. Somos Fixion.
Inspirar pessoas a cuidar de pessoas. Isso está conectado no olhar e no sorriso de quem é Sabin. De norte a sul do país, o jeito Sabin conecta você ao que existe de melhor em saúde integrada. Construímos pontes e histórias para contribuir com a comunidade, o meio ambiente e com um ecossistema empresarial mais humano, diverso e inclusivo. Seja aqui na sua casa ou na nossa casa, estamos de mãos dadas com a inovação e tecnologia para que a sua jornada de saúde seja completa. Grupo Sabin, presente e futuro conectados com a sua saúde.
Nascemos com o desafio de mudar o olhar para a saúde de cada pessoa, transformando informação em conhecimento. Tudo em um mesmo lugar, dados e serviços juntos para permitir pela primeira vez que cada um tenha a visão completa sobre sua saúde. Todos reunidos em uma plataforma, unindo forças para criar soluções extraordinárias e oferecer todo o cuidado que cada pessoa merece e precisa, de maneira coordenada e digital. Afinal, acreditamos que usar a tecnologia de forma inteligente e integrada é o primeiro passo para preservar o maior ativo de nossas vidas, a saúde. ID. Toda saúde é única.
THB é uma das maiores consultorias em saúde, benefícios, seguros, resseguros e affinity. Com foco em inovação e proximidade com o cliente, a THB tem uma equipe multidisciplinar, com consultores especialistas na estruturação e administração de programas customizados. Fundada em 1978, faz parte do grupo MODELOS, o maior wholesale broker dos Estados Unidos, e está presente em todo o Brasil. THB, soluções que vão além do seguro.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science. In everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease. The best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós da Fena Saúde temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues, enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud for healthcare.
Life Care, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Life Care já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2 mil pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica, investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos. Em pessoas que podem inovar e melhorar processos e serviços. E no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac, todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, environmental infection control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso mercado central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força. A saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados, unidos pela saúde.
O conhecimento transforma. A transformação te carrega para o futuro. Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
A Bradesco Saúde desenvolveu uma série de iniciativas que promovem orientação e cuidado em meio à pandemia de Covid-19. É o Saúde Digital. Com ele, quem tem Bradesco Saúde pode realizar consultas médicas por videochamada sem sair de casa. Veja como funciona. Para dúvidas e sintomas de Covid-19 ou outras questões de saúde, você deverá acessar o app Bradesco Saúde. Se você ainda não tem instalado, faça o download gratuito na App Store ou no Google Play. Para consultas médicas regulares com médicos referenciados, acesse o site bradescosaude.com.br. Confira as especialidades disponíveis para atendimento por videochamada e como agendar sua consulta. Bradesco Saúde, ao seu lado contra o coronavírus.
É pra ficar junto.
Inspira.
É pra saber sua história. seu estilo de vida. É pra olhar nos olhos. É pra cada fase da vida. A DASA é uma rede de saúde integrada que acompanha as pessoas ao longo da vida. DASA é pra toda a vida.
Para ser referência em medicina, é preciso ir além. É preciso ciência, método e pesquisa, fomentar conhecimento, compartilhar e formar talentos. Ao longo do tempo, investimos para termos o melhor corpo médico, as melhores instalações, a melhor equipe assistencial, a tecnologia mais avançada. É nisso que acreditamos. É isso que buscamos. Somos o Hospital Moinhos de Vento. Referência em medicina, referência em saúde.
The body is an amazing organism, designed to run marathons, think of ideas, and see a beautiful world. It's capable of complex tasks. But when the body is compromised by disease or disorders, disabled by trauma or wounds, it needs help getting better. And that's why we're here, to create medical technology that saves lives and changes lives. For the heart, the soul, the ambitions, and the dreams of every person we touch. We are here to innovate, to look at challenges from all angles, to follow patients beyond diagnosis, through treatment and recovery, to get them back to their best body, living their best lives, and being their best selves. Our ambitions are big. We are working to give people surgery without incisions, contact lenses that treat allergies, implants that monitor themselves, real-time maps of the heart. We are redefining what the body can accomplish. And even though we are a diverse group of businesses, we share a common goal: save lives and ignite all that's possible in every body.
Super-heróis são seres com poderes mágicos que voam, que enxergam o que ninguém enxerga. Hoje, fica claro que vivemos rodeados de super-heróis, dirigindo, acolhendo, cuidando, que têm feito da proteção do outro sua missão. Eles sempre estiveram aqui, só estavam disfarçados. Homenagem a quem tem feito mais do que seu trabalho para mais gente ficar bem. Mater Dei 40 anos.
Em 2021, o prontuário eletrônico do paciente do Sobre, solução da empresa para o setor hospitalar, ganhou pela 6ª vez consecutiva o reconhecimento de melhor da América Latina, de acordo com o Instituto Norte-Americano CLES. Uma vitória que é nossa, de cada um que trabalha na MV. Quem faz o PEP sabe que por trás da solução tem muito esforço, dedicação e comprometimento. É por isso que esta conquista não é apenas da MV, é do Brasil, é nossa.
Nós nascemos na saúde e nos movemos pela saúde. Impulsionados por essa paixão, nos tornamos uma das maiores empresas de tecnologia para a saúde do Brasil. Nosso caminho é trilhado por 400 colaboradores e mais de 6.000 clientes. Somos tecnologia que evolui todos os dias. Somos Fixion.
Inspirar pessoas a cuidar de pessoas. Isso está conectado no olhar e no sorriso de quem é Sabin. De norte a sul do país, o jeito Sabin conecta você ao que existe de melhor em saúde integrada. Construímos pontes e histórias para contribuir com a comunidade, o meio ambiente e com um ecossistema empresarial mais humano, diverso e inclusivo. Seja aqui na sua casa ou na nossa casa, estamos de mãos dadas com a inovação e tecnologia para que a sua jornada de saúde seja completa. Grupo Sabin, presente e futuro conectados com a sua saúde.
Nascemos com o desafio de mudar o olhar para a saúde de cada pessoa, transformando informação em conhecimento. Tudo em um mesmo lugar, dados e serviços juntos para permitir pela primeira vez que cada um tenha a visão completa sobre sua saúde. Todos reunidos em uma plataforma, unindo forças para criar soluções extraordinárias e oferecer todo o cuidado que cada pessoa merece e precisa, de maneira coordenada e digital. Afinal, acreditamos que usar a tecnologia de forma inteligente e integrada é o primeiro passo para preservar o maior ativo de nossas vidas, a saúde. ID. Toda saúde é única.
A THB é uma das maiores consultorias em saúde, benefícios, seguros, resseguros e affinity. Com foco em inovação e proximidade com o cliente, a THB tem uma equipe multidisciplinar, com consultores especialistas na estruturação e administração de programas customizados. Fundada em 1978, faz parte do grupo MODELOS, o maior wholesale broker dos Estados Unidos, e está presente em todo o Brasil. THB, soluções que vão além de seguro.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease, the best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós, da Fena Saúde, temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues, enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud for healthcare.
Life Care, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Life Care já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2 mil pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos. Em pessoas que podem inovar e melhorar processos e serviços. E no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender Fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac, todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, environmental infection control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso mercado central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
A Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força. A saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados, unidos pela saúde.
O conhecimento transforma. A transformação te carrega para o futuro. Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
A Bradesco Saúde desenvolveu uma série de iniciativas que promovem orientação e cuidado em meio à pandemia de Covid-19. É o Saúde Digital. Com ele, quem tem Bradesco Saúde pode realizar consultas médicas por videochamada sem sair de casa. Veja como funciona. Para dúvidas e sintomas de Covid-19 ou outras questões de saúde, você deverá acessar o app Bradesco Saúde. Se você ainda não tem instalado, faça o download gratuito na App Store ou no Google Play. Para consultas médicas regulares com médicos referenciados, acesse o site bradescosaude.com.br. Confira as especialidades disponíveis para atendimento por videochamada e como agendar sua consulta. Bradesco Saúde, ao seu lado contra o coronavírus.
É pra ficar junto.
Inspira.
É pra saber sua história. seu estilo de vida. É pra olhar nos olhos. É pra cada fase da vida. A DASA é uma rede de saúde integrada que acompanha as pessoas ao longo da vida. DASA é pra toda a vida.
Para ser referência em medicina, é preciso ir além. É preciso ciência, método de pesquisa, fomentar conhecimento, compartilhar e formar talentos. Ao longo do tempo, investimos para termos o melhor corpo médico, as melhores instalações, a melhor equipe assistencial, a tecnologia mais avançada. É nisso que acreditamos. É isso que buscamos. Somos o Hospital Moinhos de Vento. Referência em medicina, referência em saúde.
The body is an amazing organism, designed to run marathons, think of ideas, and see a beautiful world. It's capable of complex tasks. But when the body is compromised by disease or disorders, disabled by trauma or wounds, it needs help getting better. And that's why we're here, to create medical technology that saves lives and changes lives. For the heart, the soul, the ambitions, and the dreams of every person we touch, we are here to innovate, to look at challenges from all angles, to follow patients beyond diagnosis, through treatment and recovery, to get them back to their best body, living their best lives, and being their best selves. Our ambitions are big. We are working to give people surgery without incisions, contact lenses that treat allergies, implants that monitor themselves, real-time maps of the heart. We are redefining what the body can accomplish. And even though we are a diverse group of businesses, we share a common goal: save lives and ignite all that's possible in every body.
Super-heróis são seres com poderes mágicos que voam, que enxergam o que ninguém enxerga. Hoje, fica claro que vivemos rodeados de super-heróis, dirigindo, acolhendo, cuidando, que têm feito da proteção do outro sua missão. Eles sempre estiveram aqui, só estavam disfarçados. Homenagem a quem tem feito mais do que o seu trabalho para mais gente ficar bem. Mater Dei 40 anos.
Em 2021, o prontuário eletrônico do paciente do Sobre, solução da empresa para o setor hospitalar, ganhou pela 6ª vez consecutiva o reconhecimento de melhor da América Latina, de acordo com o Instituto Norte-Americano CLES. Uma vitória que é nossa, de cada um que trabalha na MV. Quem faz o PEP sabe que por trás da solução tem muito esforço, dedicação e comprometimento. É por isso que esta conquista não é apenas da MV, é do Brasil, é nossa.
Nós nascemos na saúde e nos movemos pela saúde. Impulsionados por essa paixão, nos tornamos uma das maiores empresas de tecnologia para a saúde do Brasil. Nosso caminho é trilhado por 400 colaboradores e mais de 6.000 clientes. Somos tecnologia que evolui todos os dias. Somos Fixion.
Inspirar pessoas a cuidar de pessoas. Isso está conectado no olhar e no sorriso de quem é Sabin. De norte a sul do país, o jeito Sabin conecta você ao que existe de melhor em saúde integrada. Construímos pontes e histórias para contribuir com a comunidade, o meio ambiente e com um ecossistema empresarial mais humano, diverso e inclusivo. Seja aqui na sua casa ou na nossa casa, estamos de mãos dadas com a inovação e tecnologia para que a sua jornada de saúde seja completa. Grupo Sabin, presente e futuro conectados com a sua saúde.
Nascemos com o desafio de mudar o olhar para a saúde de cada pessoa, transformando informação em conhecimento. Tudo em um mesmo lugar, dados e serviços juntos para permitir pela primeira vez que cada um tenha a visão completa sobre sua saúde. Todos reunidos em uma plataforma, unindo forças para criar soluções extraordinárias e oferecer todo o cuidado que cada pessoa merece e precisa, de maneira coordenada e digital. Afinal, acreditamos que usar a tecnologia de forma inteligente e integrada é o primeiro passo para preservar o maior ativo de nossas vidas, a saúde. ID. Toda saúde é única.
A THB é uma das maiores consultorias em saúde, benefícios, seguros, resseguros e affinity. Com foco em inovação e proximidade com o cliente, a THB tem uma equipe multidisciplinar, com consultores especialistas na estruturação e administração de programas customizados. Fundada em 1978, faz parte do grupo MODELOS, o maior wholesale broker dos Estados Unidos, e está presente em todo o Brasil. THB, soluções que vão além do seguro.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease, the best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós da Fena Saúde temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues, enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud for healthcare.
A Pronep Life Care, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Life Care já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2 mil pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joy Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica, investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos. Em pessoas que podem inovar e melhorar processos e serviços. E no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil.
We're back. Did you know that the health sector offers a lot of business opportunities, but it also has huge challenges for those who wish to understand? Yes, definitely so. Our businesses are growing, and we do believe that it's possible to overcome these barriers. And this is what our next panel is going to be about. We're going to talk about our careers, and the moderator is going to be Valder Miguel Jr., Director of Vertical Saúde. And the panel also has the participation of Artuligo, CEO of Saúde, José Tomás Ares, co-founder and CEO of Televisa, and Evander Copese, founder and CEO of Beep Saúde. Oh, this is going to be a wonderful debate. Please answer our survey. We have a QR code available and would like to have your opinion. It's very important for us. Okay, let's move on to the panel. Hello, everyone. I'm Valdo Gerber Jr. I'm founder of Vertical Saúde. I'm actually current director of Vertical Saúde da ACAT in the state of Santa Catarina. So before we start our conversation, I'd like to thank my colleague and friend Villar, our CEO, Rodrigo Villar, for another opportunity to be here with FIS 2021. I also wanted to thank you for my permanent participation as a presenter of some interviews that are related to innovation, challenges, and solution for entrepreneurship in healthcare in Brazil. It is an honor to receive different entrepreneurs who deal with the challenges in healthcare, and we will talk about their respective technologies that have made a difference in our society. We will also talk about the difficulties in this journey of investing in healthcare, despite the huge opportunity brought about the market, not only in Brazil, but worldwide. It also has some responsibility entailed. It's different from investing in other areas. I always say that this is the most difficult area. And with that, I do not want to scare you. Quite the other way around. I just want to say that there is some difficulty in terms of responsibilities. We're working with lives, we're getting in the market. And there is a classic operational model, even though there is a lot of technology. This is one of the areas with the most technology in an area. Like you have CTs, equipment, but it's important to learn how to use it in an institution. We're going to talk about the whole journey, have an idea, have a website, have people believe in that, validate the product, convince people that that will make a difference in their respective businesses, be it at a clinic or in B2C with the technology developed in the area of healthcare. So I'm going to ask my colleagues to introduce themselves, talk about their qualifications, their respective businesses, and I'm going to call them in alphabetical order. I'd like to thank Arthur, José, Vandro, who are part of this table here, so that we can have this very fruitful discussion. I'd like to invite our CEO and founder, the founder of AfroSaúde, Arthur Igor. You're welcome, Arthur. Feel free. Good afternoon. I thank you for the invitation. It's wonderful to be here with you at FIS. But as you mentioned, investing in healthcare entails different challenges. I work in the state of Bahia. I am a specialist in public healthcare, and I am concluding my master's degree. I write and investigate mental health and labor-related quality of life. I also had AfroSaúde, where we obtain information on healthcare. We have a lot of challenges. AfroSaúde has a full connection platform, but we also develop solutions, taking into account the Black population, offering different services. Thank you, Arthur. Basically, you created a way to communicate healthcare professionals who are Black and Black patients who feel more comfortable with this professional relationship. Is that correct? Well, also we show them that the platform can be used also by Black people, and that really facilitates the communication so that we can work with this niche. Sometimes the transmission of a message must may be more difficult. So this is something that we developed thinking about how difficult it is for the Black population to have access and sometimes to find qualified professionals to deal with race in healthcare. We also have different policies. We have had patients who went through 4 different regimens of treatment because they were not able to find a doctor who understood about the specificities of the Black population. We have also prenatal care, deliveries, and try to think about the different challenges the Black population faces. It gives us an idea of diversity in healthcare. The whole process, including communication, reducing biases. So in the beginning, our main challenge was to communicate, and we did not want to have any segregation. We wanted to provide an inclusion alternative. And when we look at the Brazilian population, we can see that the Black population dies sooner. They are the most severe patients, for example, during the COVID. And it was the Black population that also dies more from diseases that can be avoided, such as diabetes, among others. So they are usually more severe in the Black population. When we provide more diversity and inclusion, the discussion even is made easier. It facilitates participation to those who are listening. By dealing with diversity, we will solve the challenges of many. We can do this expansion. We also have the Portuguese-speaking African countries, and with this app, we can facilitate communication among the different countries. Many of the challenges we found in the beginning of this process were related to this niche, but also to the access of investment capital, because this is a product that deals with diversity, and because people who are dealing with this app are Blacks. This is something unusual. We did suffer some challenges before we were able to obtain the capital in 2019. We started in 2021. We obtained an investment. And recently we closed our first investment. We received other international awards that enabled us to go from a prototype that was working until 2 months ago, so that we could develop a full product, including the patient's journey, enabling them to find the professionals, to schedule visits, and especially telemedicine. The Black population is vulnerable, and we know that telemedicine works and it can be democratic and inclusive. We connect because we have professionals in every Brazilian state that can take care of patients in different regions. We have someone in Roraima, or a doctor in Roraima, who is seeing a patient in the state of São Paulo. And the most beautiful thing about technology is that it eliminates geographic challenges. We want to show the more vulnerable population that these technologies solve problems, they may be representative, and they work, in fact, whenever we can develop them well. Perfect. Arthur, we're going to go back to this discussion on the difficulties and this journey, but first of all, we're going to talk to our other colleagues, and then later we will talk about your difficulty in obtaining investments for your business, for your idea. I'm going to move on now. We have our colleague, José Thomas Arenas. He's from Santiago, Chile. He's founder and executive director of TeleDX, a company that develops technology for diagnosis, radiology, and other intelligent tools in the area of healthcare. You're welcome, and please feel free to move on. Hello, good morning. I thank you very much for the invitation. Can you hear me? I'm going to talk about me. I am an electric engineer at an industrial university with a degree by the University of Chile. But I have worked with technology and healthcare. And what we do at TeleDX is to develop artificial intelligence for the healthcare sector. And our main solution, the more mature solution we have, is called DAO. It is a teleophthalmology platform using artificial intelligence so that we can provide access, coverage, and diagnosis to those who have lost their vision in the treatment of diabetic retinopathy. It is a cause of blindness, and we know that diabetes is a worldwide epidemic affecting millions of people in Latin America and has such severe consequences in the healthcare and individual health of the more vulnerable population. So it's important for us to merge these two worlds, the world of healthcare and on the other hand, the world of technology and artificial intelligence, which is nowadays a little bit more compatible, but until very recently, they were two different things. So this is a first challenge, but it's also motivation for us, how we can do something so interesting and something that leads to such good results and at the same time has a social impact with solutions that reach a large number of people, especially in our region. We will talk a little bit more about this later on, and we'll give you the details about the experience we've had and also the challenges, as you mentioned in your introduction, and how we can deal this to other areas as well.
We'll try to talk about how the process is in Chile, because since you work with a diagnostic tool or a diagnostic support tool, you're probably have to register it in the regulating agency. So we can talk more about that, because I, for one, am curious about that, to learn about the behavior of that technology in Chile, which is so important and so transformative for the quality of medical services. And now, moving on with our panel, we'll go back to Brazil, to Rio de Janeiro, more specifically. Dr. Vander Cortese is the founder and CEO of BIP Saúde, which basically brings health and quality of life into the lives of people. It's lab exams and home care, and one of the biggest challenges is that it's also a regulated area, and that they have to overcome this outdated model and some characteristics that prevent the development of medicine in Brazil. So please introduce yourself and talk about your business, please. It's a pleasure to see you here again. Can you hear me and see me? Well, it was really amazing. It's this voice of Siri that's doing the translation. So jokes aside, let's move forward. As you said, Vander, I come from a family of doctors. My father is a heart surgeon. My sister is a dermatologist, and I graduated in medical sciences from the Federal University of Rio de Janeiro. But back at that time, I was introduced to entrepreneurship. I graduated 13 years ago. So that was at the beginning of college. And so it's more than 15 years ago where entrepreneurship was not such a hot topic. I think maybe many people didn't even know what that word stood for 15 years ago. So I felt attracted to that, and differently from our colleagues that went on to specialize in their different areas, surgery, dermatology. I then moved on to study business. And when I was 25, I set up my first company. So I think I have some legitimacy in terms of the challenges of becoming an entrepreneur in the healthcare industry. This is the second time I'm doing this. The first time I did this was with BR Med, that dealt with labor medicine and occupational health, whether it is admissional exams and periodic exams. And it's a chain that has become a leader in this sector, but it is a business that's B2B. And so eventually, between 2015 and 16, it was clear to me that we were resorting to our smartphone to solve all of our needs. If we were hungry, we would think of iFood. And of course, this is just to acknowledge the relevance of iFood in catering to the needs of food delivery. And likewise, if you had to travel in large cities, there was Uber, which became a synonym of shared rides, communication, WhatsApp, listen to music, Spotify, and get a girlfriend or a boyfriend, Tinder. I can give you dozens of examples of apps and platforms that are referenced for a certain demand. Well, what about health? Which app, which platform comes to mind of Brazilians? And just like I mentioned, that iFood comes to mind in terms of delivery and WhatsApp for communications. What's the top of mind app for Brazilians when it comes to health? And when I asked people that, I didn't get lots of answers. And when I did, it was often, the health insurance app. Okay, but we all know that Brazil's model, health insurance plans, most of the times are offered by employers. So if employers, the HR director of a company decides to switch operators, you're going to get a Slack or WhatsApp, and people are simply going to uninstall an app and install another. So I wouldn't think that this answer applies to health care plans, because there's no stickiness, there's no loyalty. So the room for a top of mind app in healthcare, in my opinion, is still vacant. There hasn't been any solution. So that's the easiest way to explain what we're building at Blip, what we want to be at Blip. we expect that not too far from today, somebody having lunch among friends, when they say, well, I need something related to healthcare, and I expect somebody to say, well, have you checked Blip? That's our long-term perspective, but we had to start somewhere. And we adopted a strategy that was already consolidated in several other industries different from health. The strategy of placing customers at the front and center. This is a trend that's been happening for a long time. But if you apply this to Latin America, there is Mercado Libre. In Brazil, we have Magalu, and several different cases. Several different cases of first movers. So to recap, we saw that there was this vacant space of an app that was referenced in healthcare for Brazilians, and also that there was no player adopting this approach of buying online and having it delivered to you at home. That's when we created Blip. And I used to say that the entrepreneurs that only tell good stories are not telling the entire story. It was a year and a half trying to solve that. And around a year and a half later, in the second half of 2017, that was when, for the first time, we offered vaccines at home. And really, it's easy now to talk about vaccines because everybody has become a specialist in vaccines. Everybody talks about platforms for the development of vaccines like a messenger RNA as if they were talking about a soccer game. That's interesting, but that's true. I was talking about 2017, when no one could imagine this tragedy that we went through. And that's when Blip started to grow with no open clinic to the public. In retail, there's this expression, dark store. The stores that are not open to public. So this is what Blip follows. In business books, they call it asset smart, asset light. And with that, we started vaccinating people at home, and we found the product to market fit for that. We are in over 100 cities in Rio, São Paulo, Paraná, Espírito Santo, and Distrito Federal. And we hire hundreds of people every month. And we are the biggest vaccination business in Brazil without even one single clinic open to public, only working with delivery. So we never set out to be the biggest vaccine company. That was a stage in our growth. And the second thing, as mentioned in our presentation, is clinical analyses or lab tests, blood panels, swabs, urine, stool, and we're expanding that. We're in Rio and São Paulo with labs, and we'll be launching very soon in Paraná, Curitiba. And after that, we're going to address other business units. And with that, I want to end my presentation, explaining that Blip is the biggest vaccines company, and it's still growing a lot in the market of clinical analyses. And very soon, we're going to be addressing other business units to gain relevance and become the healthcare app for Brazilian families. And to talk about challenges and pain points, our moderator is going to talk about that. Thank you, Vander, and congratulations on your journey. Usually, and this is changing, healthcare entrepreneurs are usually not physicians. They're administrators, engineers, all of these other categories, except for physicians. Physicians usually work with classic models, groups of clinics and hospitals, and not abandoning medicine and putting on the hat of somebody that will start their journey from below as a constructor and build a building. It's very hard to renounce to all that for people to become entrepreneurs, physicians, and many people try to balance out their lives as physicians with their lives as entrepreneurs, and that also has an impact on activities. So those that really wear the hat of entrepreneurs and leave a clinical life behind to place their bets on an idea, well, they have all my admiration. You and several colleagues in the south of Brazil, and they're extremely successful cases because they understand their journey differently from me. I am a physicist and I am not from the healthcare industry. I have to build my project, and I have to build my project and then only understand the market, and that could be too late. And it's all about raising awareness among our groups in Santa Catarina and to take that group of entrepreneurs and have them discuss on equal terms with other entrepreneurs so that a series of difficulties and wrong perceptions are eliminated so that we can increase the success rate. And congratulations. And now, moving forward with our conversation. And following alphabetical order, we'll go back to Arthur. And Arthur, to go into the core of our discussion, could you tell us about the difficulties that you faced? Obviously, your situation is characteristic of this history that still appears in certain classes or regions. So could you tell us about the difficulties that you went through and are going through and believe that you will still experience in this journey of being a business person and transforming your idea into something that's sustainable? Well, you were talking about wearing the hat of different roles. And this reminded me of this situation that I went through, not only in medicine, but oncology. We're not educated to be entrepreneurs. We are educated to take care of people like Blip does. We take care of people in a different way. And it's like we're educated in a box. And it was a huge challenge transitioning to a different career, understanding what being an entrepreneur is, the startup model, the business model. So everything happened at the same time. And I try to educate myself in that regard to try to be more mature in the healthcare industry. And that's when I bumped into the problem of structure that I only found out when I joined this business world, which is access to capital, access to money, and having somebody that places their bets on our business so that we're able to grow. And ever since we started validating our idea, we're able to get almost 5,000 answers from users thinking about all of the problem that we set out to solve, but we were unable to have this discussion with investors. And little by little, we were able to launch our prototypes that would confirm the idea. But likewise, there were different hurdles. I've participated in interviews where people asked me if, to me, healthcare was only related to racial aspects. But anyway, I had to give a short reply to that. but we continued to advance until we got these two investments from Google and our angel investor. We're at this stage of product to market fit, where we already have clients and we have scalability to our business because paying customers from all over Brazil, and due to the fact that it is related to technology, we're able to be present everywhere much more easily. We do not have a physical office yet because we don't need it. In Salvador, we have co-workings. Our investor has her own office, so we don't need that, and we can be fully digital. But when we go into the health tech world, some companies invest millions, and we started from scratch. But now we're being able to create enough metrics to be able to establish discussions to get better investments. So our difficulty was fully related to money, because even when I didn't know what investment was about, I needed the money to improve the product, but I needed for the product to be better to get the money. And that was a vicious circle, and we were able to break free from it. And currently my company, just like BIP, it's a great idea. And I'm thinking about how challenging it would be to bring BIP to Salvador, which is a city that is more difficult in several regards, and which impact we could cause. But we want to be a reference, and we are becoming a reference in our niche, being a reference when it comes to diversity in healthcare. And I see online people saying, well, I need a dermatologist, and people will set up an appointment. We were able to create this very strong brand with this agenda that we advocate for, being diverse, but with a consolidated niche and having market fit. And we still try to be a company only led by Black people. We are in the Northeast, and in most cases, health techs are in the South and Southeast. So we're swimming against the tide, literally. But we're trying to get the investments and the means to make this business grow even more, because there's this potential of having national and international scalability, and using several other technologies to add them to our solution. So you're swimming against the tide like that, Arthur. But can you imagine how strong you're going to be when you reach the future? Thank you, and congratulations. We have another 20 minutes. We'll have to shorten the response times, but we still have time for Jose and Vander. So Jose, can you tell us about the regulation in Chile? And if you're familiar with the regulation model in Brazil, can you tell us about the difficulties in developing these technologies, which really have a huge technological impact, in that you go into a very complex system, which is the DICON system, and you bring solutions that will make it easier for physicians to give their diagnosis? Yes, thank you. And in fact, I have a list of things that can be done, and that I could list as challenges that may not sound as obvious in healthcare. One of them is regulation, but I'll also talk about some others to show you what I'm referring to when it comes to technology. For instance, it's and something as disruptive as artificial intelligence that sometimes you don't know much about, or that you know what it is, but it's easy to misinterpret what the robots are and their level of impact on our work and the level of replacement of job positions. So it's several different things that, as I said, have to do with culture and with doing things the way they've always been done in healthcare, in medicine. Things work. or they exist in a certain way. So it's really hard to take leaps. And as part of that, there's also the lack of digitization. We've always we've always struggled with electronic medical records, interoperability, and we've advanced a lot in that regard. But in reality, it's not enough. I always say that digitization and doing the same process that you do physically, doing it digitally, is not necessarily a change, because at the end of the day, you often try to do the same thing through a different channel. And that's where we see that things can be a bit more sophisticated, such as automation and artificial intelligence, that allow us to have processes with greater reach without increasing costs. And as I told you about automation and artificial intelligence, oftentimes the first thing you find is fear. The doctor, for instance, says, well, this is going to replace me. So this creates fear. I don't know that very well. I still have some concern. So that creates rejection and resistance to change. And that is the scenario we currently have ahead of us. Only 30% of diabetics will perform an annual iFundus exam. So we want to increase these 30 and not replace them. So actually what we're looking for here is not replacement, but rather increasing and expanding with artificial intelligence. So there's this matter of responsibility in terms that an error in this industry is different to an e-learning, an automatic learning model that recommends, I don't know, a belt instead of a wallet. And it's different from diagnosing somebody or screening somebody. And that, when put to scale, there's also the social impact, which is also a challenge, but also a motivation. The things we try to do are not on a one-on-one basis. But for instance, in Chile, we're benefiting more 200,000 people a year. And this is a positive side to it, but we have to be very careful as well. And finally, before we talk about regulation, there's an alignment in incentive. It's not as straightforward. You could say, well, things that make healthcare work better is having more access, prevention, or the economy. It really depends on who you're talking to. That will make your approach different, because that's not always aligned with the goals of the payer or the insurer and the patient, which very few times they pay for their expenses out of pocket. So the payers have to be in agreement with those who execute, and especially in a digitized model, aligned with the model that we are talking about now, that has to do with new physical structures, but also with digital networks to better escalate that. Well, that has to be considered. And these things are not obvious at all. And maybe currently they're a bit more palatable than a few years ago. And concerning regulation, which is in fact one of the aspects that is different in the sector than in others. You can make a prototype and release it for sale, and that could be linear. And there are many things that are easy to overcome here. But for instance, regulation, which is, I mean, how can you demonstrate that what you're proposing does what you say that it does? That's different from a prototype, right? Especially in terms of artificial intelligence in our country, in the United States. The most developed aspect is regulation of medical devices, the artificial intelligence systems, the systems that provide support the so-called supporting software to medical devices, such as screening, for instance, and all that. And that's aligned with the roadmap of devices that has to do with the level of risk classification, or if the monitor is regulated or not. I mean, several things. But in Chile, there are few medical devices subject to the surveillance of the entity in charge of that. So the first thing that people think is, well, if out of a list of 2 or 3 medical devices, we can sell them, of course. But actually, in reality, it's different, because when you do not have a clear roadmap, you can do whatever you want, but in reality, there will always be a reason for someone, for whatever reason, to say, well, but this does not meet this or that rule. You can, for instance, propose a software as a medical device, but you cannot present the clearance of the regulating agency. So somebody's going to tell you, well, maybe the clinical study that you did should have greater sensitivity or higher specificity, and that should be proven like this or like that. So that's a challenge, and it could be even greater if it's less regulated. And in the case of Brazil or the US, with their own respective costs, of course, artificial intelligence is still very immature. Less than 4 years ago, we tested the first software for AI for diagnostic purposes. And so that's still incipient. It was launched, but it's not fully resolved due to different reasons. A medical device software using artificial intelligence is something that is alive, and new versions get released all the time. And that's different from a physical device where you could have a version and freeze it indefinitely. So there's a series of challenges associated to that, but we're making progress. And what all regulations have in common is that whether they're totally structured by the agency or not, is clinical assessment and demonstrating with studies and all of the ethical and clinical considerations in literature. And as I said a while ago, these systems do what they say they do. In terms of reaching the precision levels and sensitivity and specificity, the minimum levels to interfere the way they set out to interfere, and that's different. And the level of responsibility has to do with the level of responsibility of the healthcare devices that supplement these pieces of equipment. And it's not the same thing to make a decision about a cancer patient and that has one single visit, and you have to make a decision that's totally determinate at that time, and you may not see them again, versus something that we have, which is annual exams or screening exams, non-diagnostic tests. So the challenge is for not making specific decisions one single time. Thank you. Technology usually precedes regulation, and pioneers redirect this market. It's important to have serious companies and having intelligence on board for these results. Out of curiosity, Jose, are you already operating in Brazil, or are you interested in coming to Brazil? Yes, we are operating in Brazil. Yes, we have an initiative that now is more at the national level. We're not yet selling it, so we have not yet defined the regulatory requirements, but it's something that we've been working on for a few years now and creating evidence and investigations for our platform. And we'd be very interested to be in Brazil because it's a huge market, especially for Chile, compared to Chile. Thank you, Vander. I know that you're eager to tell us about your stories and in your trajectories of being a business person in Brazil and transforming the business model. Because really going to a lab to an exam is really a chore. I have 2 children at home, and we have to leave early, not to get there and have long lines. But well, having that at home would be great. We've done everything. We've been doing everything at home with my kids, with personalized care. I would go to the clinic, everything that I had at the clinic, but without having to drive my car to the clinic and so on and so forth. So yes, please tell me a bit about your trajectory. Of course, I have a professor that helps us at BIP. He says the younger the child, the more work you do. And that also applies to, I have 2 kids. The younger the child is, well, the work is much bigger. I have a 3-month-old child. I just went to the pediatrician and I rushed over here because I was there. Yeah. And just to make a connection with my last remark, I think you were quite accurate in what you said, that for the entrepreneurship in healthcare to grow in Brazil, we need to overcome the fact that we don't have insiders, we don't have healthcare professionals, except for a few of us, like me and our fellow panelists, the dentist. It's fundamental for these healthcare professionals to become entrepreneurs, because it's not like it's an obligation. We have cases of people who did not graduate in medicine. Felipe Lorenzo from iClinic, for instance, a successful startup, and he graduated in engineering in health informatics. So it's important to have what I like to say, to quote what I heard from another entrepreneur, which is the founder market fit. A lot is talked about the product market fit, but very little is mentioned about the founder market fit, which is the capacity and the legitimacy of a wannabe entrepreneur to fit in the industry that they want to become entrepreneurs in.
Well, that's physical, but I would never start a business that would involve physical, or I wouldn't go into agribusiness. I've never been to a farm myself, so what would I do with agribusiness? So I don't think that entrepreneurs can make anything works. We do have the issue of legitimacy, the insider's view. And this is just to add to my previous comment. I see that entrepreneurship is growing, but this is only one of the pillars. We have more people who are becoming professional entrepreneurs. By doing that, we also attract qualified funds. We know that venture capital is like food for entrepreneurs to grow. And you have venture capital funds that are specialized in healthcare. We have DNA Capital, which is perhaps the fund that has the best understanding of healthcare globally. We have an office in Rio, another one in São Paulo, San Francisco, in the US. So you have more qualified entrepreneurs, and then they include healthcare in their specialized care, and that makes things happen. So we have a pandemic which has levered, and a lot of people have said that health care is another fintech. Sometimes I am married to a doctor. My father is a doctor, and I have a lot of doctors around me. So I can say that full employment in healthcare is really a barrier, and it's hard to give up on that and invest. A lot of people say that it's under bridge, but you know, to invest in healthcare in Brazil, if you do not understand that you have to invest as a life and death matter, and you know, you really need to want to make it happen. Otherwise, you will not survive in Brazil. Still about challenges, I want to steer away from what was said before. We have regulatory issues, but there's something that is true for tech companies, and we have to talk about this, and somehow that has to change over time. Otherwise, we're going to lag behind. We have the software developers, the and whatever you call them, the number of people trained in Brazil that are ready to be developers is not even close to what is necessary. So for anybody here, anybody listening to us, we have a company with a technological basis, but we still have a lot of difficulty nowadays in having good devs. The other day, I sent a message about something beautiful that has been done. I sent a print to another entrepreneur, and they said, okay, we no longer have devs in Brazil, because you have a larger round, then you become more powerful. You do not have enough devs, and you still have to attract more. And we also have competition because our currency is has a very low exchange rate right now. And when payment is made in dollars, how do you deal with that? So we have challenges to invest in Brazil. We have a lack of developers, and we have to somehow deal with that. Otherwise, Brazil will not be able to have the startups and the companies that the country could have because of the capacity of the investors. And we know that Brazilian entrepreneurs have their specific needs. I wanted to highlight that. We also have the fundraising issue. As mentioned before, accessing capital is essential. And I can see that there's a lack of knowledge of Brazilian entrepreneurs. The system in Brazil is just beginning, but there's a lack of knowledge about the dynamics of fundraising. You have to understand what the right fund is for the company, the sector the company works in, and understand that sometimes we'll have investors who will decline you, not because they don't like your company, but because they do not have your geography, or sometimes, they want to see you later on. So Brazilian entrepreneurs need to learn how to better navigate. It will be a win-win for everybody. I say this because I suffered from this in the past. We had a 100% organic growth in the first round. In the second round, I had to face the pros and cons of venture capital, and of course they do exist, but this is more natural for those who work with engineering and economics, but we have to learn so that we decrease this balance. These are important factors for those who want to invest. Regulatory issues will always be present, but they're difficult for me and they're difficult for my competitors. This is the rule of the game. That was quick. Yes, you're right. In my state, we have an environment of technology and innovation. Today, we have more than 5,000 openings available, and some companies are despaired about that, or they're desperate about that. And the community, the private community in the state is creating mechanism to create or to develop developers. We work with programming, but today there is a robust activity trying to qualify people because some companies really are desperate about finding developers so that they can make their deliveries. And that generates a chain of events. If your company has an investment, 100 million BRLs, 60 million BRLs will be used to hire people, to pay for labor, development, the market, and so on and so forth. So where are you going to find them? So that will prevent development from taking place. And there are other issues here in Brazil. We have the economic subvention. Today, Brazil is basically digital in terms of its health tax. Depending on hardware is a problem. Investment in technology is going down. So where is the inspiration? Where is the motivation to observe and invest? We could have another discussion altogether because we're talking about reducing possibilities. Perfect. Yeah, we agreed. We had a small delay. And then finally, perhaps an aspect that was not mentioned is that healthcare is a regulated industry, but it's also a monopoly. For example, you have hospitals, you will have 4 or 5 large groups. The same thing is true for operators, for labs, and it's difficult to compete in this scenario. So each one of these items could be discussed for 1 hour. Yeah, we also have the market leaders who want to operationalize, and the wait is so long. Anyway, once again, I would like to thank all of you. Thank you, Arthur, José, Wanderson. It was a very interesting discussion, but that was bound to happen with so many experts here with us. I wish you all success. I hope to see you at a different moment. We're all talking about glories here, and all of us have our own glory, but I'd like to highlight how good it was actually to invest in this area. Once again, Josie, Diego, and Rodrigo, I wanted to thank you all, the back office, Flavia and her colleagues who make things happen, not only now, but all year long. I thank you all, and I hope to see you in FIS 2022.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity, a surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right. Once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science. In everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease. The best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós da Fina Saúde temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues, enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud-for-healthcare.
A Pronep Life Care, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Life Care já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2.000 pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica, investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos, em pessoas que podem inovar e melhorar processos e serviços, e no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac, todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process, and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas, and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, environmental infection control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso Mercado Central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso Oasis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
So we're wondering if you're enjoying our event. We'd love to hear your opinion. Please answer our survey. Just point your camera at the QR code on your screen. And please remember to use our filter which is awesome. We're going to be talking about our next panel that will talk about artificial intelligence and technology in the future of prevention. Our moderator will be Alonso Verdugo, the medical director for Microsoft Latin America, Bernardo João Rachadel Jr., manager for technology and innovation at ASK, Felipe Ricci, head of innovation of health for Stefanini, and Jose Carlos Prado Jr., former Subsecretary General to the Municipality of Rio de Janeiro. I'm sure that this will be an can't-miss panel. Good afternoon. We're live now. I'd like to greet our colleagues, Alonso, Jose Carlos, and Felipe. Welcome to our panel on artificial intelligence and technology in the future of prevention. I'm Bernardo, manager of technology and innovation at ASK. And to start our conversation, I want to propose a few questions that probably do not have an answer yet. For some others, we already have greater clarity about. So let's start our conversation to talk about the state of the art in this industry. Alonso, the medical director for Microsoft Latin America, will talk about his experience. Dr. Jose Carlos Prado Jr. will talk about his experience as a physician. And Felipe Ricci, the head of innovation for health at Stefanini, will also give his contributions. Whenever I talk about this subject, I mention a sentence by Stephen Hawking. He once said that all aspects of our lives will be transformed, and this is probably the biggest event in the history of civilization. And this sentence has a lot to do with the world that we're experiencing now. There's a lot of information about the growth of in the amount of data and data sharing, the growth of technology. Yesterday, I was watching a lecture here, and a physician said that every 72 hours, medical data gets twice as big. So if you think about a reality in terms of civilization, that's huge. We're going through a huge digital transformation. And now in the health industry, we have artificial intelligence as a guidance for our future, or as a driver of our future, better said. And one thing that I'd like to mention is what's the penetration of artificial intelligence in healthcare? Well, I work in healthcare management at ASK. It's an administration company, especially for supplemental health, but we also work with occupational health. And in our experience, our main focus is the application of data to help optimize the treatment of patients and the collection of clinical data to define diagnosis. And it's based on that, we've been seeing some initiatives and good progress correlating imaging exams as an assistance to diagnosis. So always thinking about artificial intelligence as an ancillary tool to diagnosis. In addition to that, on August 28th this year, the WHO published an article on artificial intelligence and its evolution, and they mention important aspects about data privacy and about aspects related to patient care, their privacy and security. And Additionally, there's also a few other publications, and I brought one that I think is very interesting from Harvard that talks about where the top 10 applications of artificial intelligence for the next few years will be. And they predict that by 2026, the top three places will be robot-assisted surgery, virtual assistance to nursing, and a process control in the administrative area. As a second aspect, we can also talk about security and safety, and maybe the third and fourth aspects, maybe for those we could talk about, well, artificial intelligence is a tool, and just as with any tool that we invent as human beings from the wheel, and from then onwards, it can be very well used for very important things in our lives, and we as the leaders in technology and market leaders, we have to think about the risks that can bring about, which oftentimes are not very clear, especially because we get carried away by having new things and the benefits brought about by these novelties. And I think that with these three things, for one, healthcare is already enjoying the benefits of AI. And what are the dangers in terms of danger to information? We can talk about the General Data Protection Law. In Brazil, it's been at the center of many discussions politically and in terms of administrative discussions, and maybe in that regard, Alonso can give us an idea about the data protection laws outside of Brazil and tell us about what that is looking like right now abroad. And if we look at the future, where we can see the good applications and the risks of using that technology. So if you allow me, I would like to ask Felipe to first introduce himself and also talk about your perspective, please. You have the floor. Well, thank you for the invitation. I also want to thank our colleagues for the opportunity to exchange information. And it's important to talk about how technologies can have a positive and a negative impact across different industries. And to give you a panorama, at Stefanini, we work very strongly with the perspective of the future, where we have some frameworks that understand what are the possible future scenarios 5, 10, 15 years from now in some segments. And when we started working on prevention and technology and how these two segments get connected, first we set out to look at the future and understand what drivers were going on, and to try to create a path that makes sense. And with that, we brought the ecosystem as a whole, doctors, patients, industries, companies, to understand that. And with that, we saw that this trend, it's a growing trend in terms of how to work on health promotion and prevention. It actually exists. And in the future, in the next decade, it will have a huge impact on economy and society as a whole. So this theory is validated, so to speak. And with that, we then started to understand how to take the opposite path. If we understand that the future is about thinking about prevention and promotion, and then you start having a mix of prevention, promotion, and well-being, these three aspects start converging somehow. And when we did that, we understood that we do have a possible roadmap to get to these future scenarios and to reach these so-called preferable futures. in terms of providing education to people and giving them tools that make sense to the community as a whole, and that are not simply items that are there but do not make any sense at all. So we started to see that there is a very important aspect that, and speaking from the perspective of a biomedic engineer, we sometimes overlook design. And last year, I focused strongly on understanding how design, how the creation of an experience and specificities in people's lives are important if we want to talk about prevention, whether it is through technology or not. So again, technology is always a means to an end, and the end is for people to understand that they have to change. So how can we do that in a fluid manner that will not create friction and that really makes sense to everybody, to economy, to society, to everybody? And with that, we were able to identify how each player has been operating or can operate in that regard. So we drew a map of several players, pharma and tech companies, the government, and how each one was behaving and moving along that path. And we started also looking at the financial aspects, banks and also retail, which can give support for us to create a cycle where this cycle makes sense to everyone, and so that we avoid cannibalization, that everybody can profit and create a relevant experience to patients. So when we looked at this entire ecosystem and when we started thinking about solutions for each of them, we saw that technology is supported by design, by this experience that we want to build, and it's also connected to what people demand. So it's not enough for us to think that prevention and technology will be there, we're going to use it, and that's it. We have to understand what they need today, what the legacy allows them or leads to the existing problems, and how to pave the path towards the future. So there's this complex movement that we have to make, and which is important, and it's all about legacy and the present, what people are experiencing today with the pandemic and post-pandemic, and how we can work with this movement, this moment between pandemics, as apocalyptic as it may sound, and the future, what people are thinking about for the future, for society as a whole. So working very well with these three major areas is relevant, and it brings about very good results because it adds value to everyone. So we bring these this ecosystem and these three moments, past, present, and future, and we are able to pave this path in a way that there's no cannibalization, and that people understand how to support each other, and permeating all that, of course, technology includes AI. And in a nutshell, I would say that this is what we're thinking now, and this is what we're working on. So with present, past, and future, and also broadening this ecosystem of healthcare as a whole.
So I think that you have mentioned something very nice in what you said. In addition to past, present, and future, you talked about engagement and how we can launch things which sometimes may engage. And this point is really crucial. And here in reality where we work, when we had the pandemic, well, it's impossible to talk, to have anything during the pandemic without talking about the pandemic. So we launched our telemedicine services, and we already had something like that, and we were really worried about engagement in our surveys. The response was very good. I think that telemedicine is something that came on very strong. We had 90% of our telemedicine users would use the telemedicine services again. So this is a very strong piece of information for us to go on. So let's get the example from telemedicine and take it to other areas. And then I would like to involve Dr. Alonso to talk a little bit about the reality at Microsoft. Please, Dr. Alonso. Thank you very much. Well, first of all, I would like to thank FIS for allowing Microsoft to share its experiences. And I apologize for my Portuguese that is non-existent. Well, in the first part, as a doctor and a Latin American physician, we have a few significant challenges in our region, which are shared. Well, from Mexico to Patagonia, including Brazil, there are some shared features in the way we work, and we share the same limited funds for health, chronic diseases, problems with infectious diseases, and a young population with risks, social risks. So these are some of the themes that we have in common. Now, the pandemic has shown us the technology, and when I talk about technology, I'm talking about IT information systems, information technology. They are enablers for health that were not seriously contemplated before. So I would say that in terms of industries, health is the one that had the more used the less technology, or at least acknowledges the least. So we have lots of medications, therapies, many things, and we need to use. But now, when we talk about information, patient information, we have a huge challenge. And so emergency patients that are unconscious, it's impossible to know their history, allergies, and then we have a work that may be very difficult. In the area of chronic diseases, the patients sometimes migrate. Sometimes you don't have very long to see patients with diabetes and hypertension. It's not enough to just give them a formula or a combination of treatments. This is the face of people when they get to the health system. In terms of those working in healthcare, we need to worry about funding, costs, operational availability of human physical resources, appropriateness, administrative processes for authorizations, and so on and so forth. So health is very complex, disconnected. Unfortunately, there are initiatives of interoperability, and now they are providing the first results because you're having some standards defined. But our industries, in other industries, they solved it years ago, for example, in manufacturing, banking. So there are some processes already working in terms of interoperability. Within this very wide-ranging spectrum, we have a problem of technology. It needs to be teamwork. We need to invest our best capacity. At Microsoft, gets in a significant point is Microsoft has been working in the health industry for more than 20 years. So we know how to include technology. And now with the pandemic, this was became very evident. So Microsoft, yes, we are providers of technology, of technological capacity. And today we have business associates that use these capacities and that enable solutions for our customers. These capacities, for the first time, Microsoft concentrated all of them in the industry, which is called cloud for health, which is a cloud for health. What does it mean then? So it's not just a database or a set of applications. What Microsoft wants to do is first to have a system of information that is standardized, that is uniform. So there was no standard in the industry before, but it is operational. So there is a server, defined parameters, and all the implications. So consume it as a service. Still agreeing with it, there are information from different locations in different formats that needs to be harmonized and implemented. And when they are implemented, you can do many different things, analytics, and we really like talking about that, having reports, artificial intelligence teams, visualization, sharing data with third parties, machine learning. In the case of Microsoft, we have other things that are associated to that for cancer. This is not fiction. They're already being used. They're used in clinic, in clinical practice. They're not just limited to research. So it sounds very nice, doesn't it? But they are part of the health process. So Microsoft has been working very intensely to do that. And this is one of the entities that is making this option for its risk assessment and risk mitigation processes. So in healthcare in the recent years, there is a model of repairing whatever was wrong. So, for example, the medicine is based on repairing what was wrong. Just someone has an appendicitis, they go for surgery, for example. So someone, for example, doesn't exercise, doesn't like vegetables, smokes, drinks. So these are all risks. So it's not just about giving someone something to correct a problem, but we need to work with prevention. We need to understand the risk factors and have a full health management process. So the WHO has creating a health system to work with preventive. So health between people, from people to people. It's not just between processes and people. But let's say an appendicitis. So there is a process, appendectomy. No, it's a care process, there's surgery. And that's it. Really, it may be the case. So this is the case. It's not a process, it's case management. So now we are managing people and cases. And Microsoft has worked intensely in terms of collaboration. And so this is the greatest ally in discovering during the pandemic with telemedicine. And so it's not just a visit, an appointment with a doctor. We are capturing information. There are many priorities and themes, but which experiences are there in that area? So we have entities, for example, in the Ministry of Health of Singapore, that before the pandemic, they were using capturing information of citizens, what they eat, what they do, if they exercise, and then they upload it to the cloud using artificial intelligence algorithms. They can predict what is the best recommendation for those people who were during the pandemic, wherever they were, to see that people who exercise more, who had a healthier diet and had better weight control, wow, they had a lower risk. So this helped people change their lifestyle to avoid the emergence of diseases and to reduce risk, which was something of a very high cost effectiveness. We have had very similar experiences in Latin America. We had a provider in Colombia providing care to millions of people. But during 6 years, they were integrating a digital aspect. They could reduce chronic diseases in patients for which they received $500 a year to do all healthcare. So it's not utopical. It requires a number of processes and integrations. At Microsoft, we have the technology, and we have worked with architecture and the process of design thinking to do things to make them agile, fast. We have Stefanini and other participants, for example, that are in certain niches have made it possible for us to get to a customer, understand what they need, their collaboration capacities, analytics, information integration, and to enable that to provide care to patients. So I know I spoke a lot, but these are my experiences. Artificial intelligence will not displace professionals. It will help them to work. So it is a work that has a certain time and a certain risk. We didn't have that in the past. We have that today. Number two, privacy must be assured and protected. This is critical. For Microsoft, privacy is so very important that all our cloud meets the PDGR, and they have, this is related to all countries. So it's not segmented. It works in the entire cloud of Microsoft. So whenever something is built, it will be compliant with all secrecy laws, whether it's in Europe, Latin America. We are meeting all the regulations in terms of data protection. And something else that we have been working in Microsoft is the use of artificial intelligence. We already have some experience. We've been working with technologies, and this has made it possible for us to discriminate trends. Microsoft has an area dedicated to artificial intelligence in terms of public health, security, and they are our pillar for the use of technology. And this is all I wanted to say. This was an overview and all the backdrop that I wanted to give to you and the standards that we've been using. And this is everything that we are promoting. Great, Dr. Alonso. Thank you very much. It's very important to know that big players in technology that are so strong are investing in artificial intelligence, in the handling of data in major volumes, and taking in consideration 2 points that I found very important in what you said. Number one, the ethical issue. So much beyond the simple safety or security or privacy, ethics in the use of artificial intelligence. We as civilization, we're still beginners, we are novices in terms of artificial intelligence. We still have a lot to learn in this area, but it's important for us to create knowledge, to create education on artificial intelligence, and to build it over solid foundations, which is ethics, good practices for technology. Another point you mentioned, and which I cannot fail to mention, and this is going to be the connection with Dr. José Carlos, is precisely the issue of costs. So when you talked about health costs, I remembered a story in The Economist, and they questioned some technology managers. They asked the question to many technology managers, which are the main challenges that countries must face in the area of health. And number one, they talked about health costs. And then Dr. José Carlos, who worked in public management in a huge environment, Rio de Janeiro, and then please share with us your experience. How is artificial intelligence and new technologies, how did it support and are still supporting your initiatives in health prevention?
Good afternoon, and thank you, Bernardo, for the opportunity. I also want to thank FIS for the invitation. I had the opportunity to experienced 7 years of administrative work in Rio de Janeiro in the public sector. And then in Sao Paulo, I also had the opportunity to work in healthcare insurance provider and also a large operator, a multinational operator. So I was able to expand my perspective. And I must confess that in supplemental health, there's a lot more opportunities to this kind of technology and this type of, well, even the startups, in terms of contact with them, exposure to events and whatnot. So I think this is the first aspect, this asymmetry of opportunities and how much we're moving towards a more unequal society with inequities. And I think that's one thing we have to think about. But technology, regardless of whether it is the public or private sector we're talking about, technology is there and we're being monitored constantly. Uh, Increasingly more scientific articles are being elaborated and published using artificial intelligence, which seemed impossible a few years ago because we always used the criterion of the methodology of classic epidemiology, and it's there's really a an invasion in large journals, and there's also a generational aspect. People are using increasingly more this type of tools and apps and gadgets. They're younger and tend to use it more and more. And currently, algorithms are currently commodities, whereas in the past, algorithms themselves were kept locked away somewhere, but not so much now. They're public domain. What's really relevant now is how to apply these algorithms and translate them into useful and relevant information to society. So if you ask me how I see the future in promotion and prevention, well, precision medicine, I think, is a trend, and will be offering more and more personalized care to people in the social context where it's not associated to reality of the neighborhood and the environment where they're working, but increasingly more offer personalized solutions, not only in the private sector, but also in the in the private sector, in the public sector. In Rio de Janeiro City, for instance, there's an app that is the entry door for users to access healthcare systems and a management platform where healthcare professionals interact with users and very strong analytics where you can translate the entire set of data into information that's useful to the decision maker. And I like it when it comes to prevention and promotion. Use the risk pyramid, which allows us to provide greater care to those in healthy. We will offer a non-cost effective solution as all patients to manage them. But we're going to use devices or apps that allow us to measure the well-being of patients and measure how their mental health is, and also chatbot strategies using robots where you can communicate with the population at very low cost with the same impact as you would have if you had a human being talking to the patient. So we're talking about um, primary promotion and prevention. So we have several channels. I think that one gap that is still huge is the terms of how we can be more effective in terms of having a virtual appointment where some fundamental aspects that we learn at medical school are not there, such as propedeutics. You can even do that remotely, but the physical contact, how to replace it. So there's several devices that are being developed, very interesting ones, but they can't solve everything. For instance, no patient. I know that there are startups trying to solve that, but it is still a big barrier in that regard. And I see future and evolution of what we're now seeing. If you look at the pre-pandemic scenario, 67% of medical equipment sold in person in the public sector. The digitization started this year with the administration of Mayor Eduardo Paes. Secondary prevention, it's very important to use artificial intelligence tools and to do early diagnosis. For that, predictive model to identify in your population the possible diabetics, and here the private sector is in disadvantage because they do not have information about clinical data, and the healthcare operator have no contact with the medical records unless they're totally organized, but you have no contact with the clinical data information. The forms they basically focus on cost. So we have to develop AI tools to predict the investment needs of patients becoming hypertensive and diabetic, as well as imaging exams and skin lesion exams in the labs for you to do an early diagnosis of cancer, for instance, and start correct patient journey. After you start a patient journey in a not so correct manner, it's harder for you to change that journey or almost impossible. There's also the aspect of patient engagement, patient loyalty with that specific healthcare provider. And focusing on public health, I think that with risk stratification of our population, we're able to get to know our population better through primary care. We have family doctors, family nurses, and can get to know our population from a clinical standpoint. So that's yet another advantage if you compare it with supplemental health, which is much more fragmented than public health. And once you stratify that, you're able to provide the better care. And if you use the app, it comes as default. So you can list your patients with high blood pressure, diabetes, and for those ones with scientific evidence, you can intervene in a more personalized manner with predictive models and also predict negative outcomes for those patients. And healthcare surveillance, that's yet another important aspect where by means of AI methods, clusterization, and analysis of components, and also why not by using more sophisticated algorithms of methods of neural methods such as deep learning to really identify these patients and clusterize them. For instance, patients with TB according to the social demographic profile of patients, and also improve the accuracy of location. And we had a very interesting experience during the pandemic, not only in the public sector, but I think the public sector led that, which is the fact of using social media to define whether people are maintaining social distancing or not. So you can break that down by social economic profile and etc. And in Rio de Janeiro, we were doing risk stratification and using chatbot to communicate with people. So communicating with people is one of the biggest benefits in the public sector because you have no scale. Establish a centralized communication with the population, but at the same time, you have to use AI tools and chatbots to reach out to that population and try to find who needs human contact and redirect them to the primary care team in charge of the patient to reallocate them to at-home visits or set up an appointment for patients with gaps in their treatment. I think that's it. I could talk about more about that, but well, that's what I had. And if there are any more questions, I'll be able to contribute more. It will be a pleasure. Thank you, Jose Carlos. Thank you for sharing that with us. And well, that was really a lecture. And we saw at the beginning of your speech something that Dr. Alonso also touched upon, which is using AI to customize customer care. Because treating a patient, I'm not a physician, I am an engineer, and we see that physicians will try to give specific treatments to patients, but on the other hand, using AI strategies, big data, and gigantic amounts of data allows us to care for the population as a whole. So it connects both ends. We're talking about both possibilities, a super personalization in healthcare as a whole. I also saw that you mentioned something related to what I work with it, which is supplemental health and its challenges. We have a strong team in data at Ask, and we carry out several studies. We had a specific study about terrorism to find out a better path. And that was the conclusion we came to in terms of cost effectiveness and patient outcomes. So we added the terrorism event and the guideline, which is a guideline for hospitalization, where you're able to at least get an ICD code, and we're able to optimize it and bring information about paths that for the patient treatment and for the healthcare provider, and so the application of AI in mental health. Of course, there's these factors, and that's what's interesting in the private sector. It's very strong in processing, and the algorithms, as you said, they're more open in terms of processing. There are other initiatives, and the public sector has great database that is huge and that we have to leverage, of course, in a secure way, but that has to be leveraged. And now we already have a few questions. And the first question is, how does the work with the social determinants of health? I'll ask Dr. Alonso to answer that, but then the other guests can also comment on that, please. Thank you. Thank you very much. The social determinants of public health, and I agree with the colleague that talked about public health, and it demonstrated that in the last years, being able to change that health by population health in an integrated manner, not only by building new hospitals or expanding that by placing other doctors in hospitals. When it comes to social determinants, we're talking about education, access to water, and for instance, drinking water and areas for leisure and entertainment, and among all of that, in that context, artificial intelligence, when you recover by means of big data, the data of individuals in a clinical context, in addition to their social aspects, you're able to create models to predict risk and to predict which social determinant more relevant as compared to another.
It is appropriately used, and considering the social determinants and risks, it makes it possible for us to communicate and also to find which are the priorities to improve impact, and also the emergence of chronic diseases and other problems. There are some very, very interesting experiences with that regard that would be very interesting to use artificial intelligence for prediction of risk when someone has a positive test. And also based on that risk, we would prioritize. So if someone with a higher risk, you're going to do certain things, then we need to make changes in lifestyle, or just the usual follow-up. And the reports that we have had so far in terms of technology, it is an important impact. But these are basic algorithms. But yes, they were strong enough or important enough to change outcomes. The other thing is the NHS, the British health system, they use in a safe way algorithms to manage chronic degenerative diseases and things like life events. For example, a diabetic person who gets a divorce. This has an impact that might lead them to fail in compliance with the treatment, and they may worsen the disease. For example, they may have amputations or even worse things as a consequence of diabetes. So these types of elements using artificial intelligence have made it possible for operators and providers to see this and could respond to the care of risk groups. Another important thing with social determinants of health is to define risk. And so there may be a group of persons with a certain strategy assuring that there will be a positive impact. There are many experiences, things that can be done in terms of methodology. But thanks to artificial intelligence, now it is possible to make operational. Oh, great. Still talking about the social determinants of health, I'm going to go to the other end and I'm going to ask a question, which is the following. Artificial intelligence in the world, and we have heard of many possible applications, but in mass, as it's been said, it's very strongly applied in recommendations, in the banking industry, in other business areas. This is very strong. In health, we still have a long, long, long way to go. So it really makes sense to have this chain in this space, which is slightly more, which is slightly slower, because we are treating people and there is a very strong criticism. Now, if we think in terms of recommendations, and then we think you watch the video and you watch the wrong video, and then you may take it on, you will never remember that that happened. That will not cause a problem. In terms of health, one recommendation, the wrong recommendation, using an example indicating a specific case, which is artificial intelligence for the recommendation of some treatment or some form of care. Now, if artificial intelligence makes a recommendation that is mistaken, and this is not impossible, it can make mistakes, this is a huge risk. I have one vision, and I can give one opinion, is I think that artificial intelligence combined with the healthcare workers, doctors, and other healthcare workers, and then we will be able to make it evolve. I would start with Felipe. How can we evolve, make it progress slightly faster in terms of artificial intelligence in healthcare applications? Well, this is a very important theme. and then it converges. It looks like scientific intelligence. So it's a robot that is a physician that is going to make the diagnosis. We are not seeing this. This is really a delicate issue. There is an issue of that we need to test after test, many tests, with less complex themes. So really, in fact, testing it on a day-to-day routine, for example, in terms of nutrition, something that we can validate, test, until we have a higher accuracy. For medical images, it has been evolving very fast. Maybe risk stratification, filters, it's moving forward very fast at a very interesting pace, but with many warnings or cautions that we need to have, having dedicated people to do the work. And this is a more complex work to understand. And each person will make the necessary triangulations. So what we have been seeing is this: how can we get other experiences that would not put people's lives at risk, and then we start working in health with simpler issues. For example, helping people in their day-to-day lives, how they can make small routine adjustments to improve well-being, quality of life, and we start scaling it up of how a nurse can use the data so that once they go back to the clinic, office, hospital, they have intelligent or smart data there available, easy to detect, to then take an action as a healthcare worker. So we see that there are some ways or paths that are somehow still complex, but we'll start validating a few hypotheses, and we are going to gain more space on these themes. So this is a very complex theme. And so I still have the vision how startups have been doing in terms of testing, small hypotheses, testing with a specific audience in terms of results. And I think it's a vision that we need to somehow embrace too, as large corporations, as big companies, so that we can evolve together. And this is something that we have been seeing. And this is what we are seeing here. Well, I agree with your trajectory of us being able to define small plans. When we talk about startup, we say, well, let's do fast so that we make mistakes fast. Let's have a pilot. So you implement a pilot study, and then I learn more, and the audience is also getting to know. Sometimes in AI, this is something new, and then in more controlled and lower risk environments, and then people may get used to it. Well, we are running out of time. I'm going to ask a very brief question, and this is to Dr. José Carlos, because I think he will be able to answer. How can we democratize to the benefit of the majority of the population, maybe make it available to public services? This question comes from Mauro Bakanovsky. Dr. José Carlos. Excellent question, thank you. I think that this has a lot to do with the relationship that we have with the public sector, which today is very not really flexible. So when you relate to the private enterprise, there are many regulations that many times prevent you from having agility and from your being able to have a pilot study and then making a mistake. Because if you make a mistake on a startup, cool, nice, well, that's even positive for you. Yeah, well, rapid pilot. It's well seen. Now, if you make a mistake in the public sector, you're wasting taxpayers' money. So we need to change a little bit the mindset of control agencies. And there are some interesting initiatives. For example, the city of Rio de Janeiro implemented like a startup hub, not for health, but focusing on sustainability. And it has more related to the previous question of social determinants. So startups thinking of sustainability, thinking of violence, and solutions, sustainable solutions for the city. And then you have an incubator of startups. And then afterwards, you can establish a business model that will be slightly more agile. In health, I have to admit that we weren't able to do that. There were 2 initiatives this year that were very interesting and more generic, and plus 10 or 20 donations related to COVID. But it's always a huge difficulty. So for you to be able to democratize, it's like changing regulations, health regulations. Another point which I find fundamental is for you to be able to democratize source codes too. And this is very nice. If we take the main companies today, they used to use in the past very expensive and complex systems. Today, we have collaborative systems such as R, Python, and they're the best ones for you to conduct more elaborate analysis. So it's a matter of developing people and talents with a new mindset. So you don't have professionals that have an education, not even in a private, to be able to manage the entire transformation. So in the public sector, this is very necessary. So people who can use data analytics, people who can mine data, do data mining and transform data, because there's a huge volume of data. So you being able to streamline the data, such as the example I mentioned, that are 500 variables in surveillance, and with 20 variables, then you have the same result. Well, so regulation, making codes more democratized, open, and more collaborative. And number 3, education. Wonderful, thank you. I am going to very briefly, 30 seconds each, to say goodbye. So first, Philip. And so thank you very much for the opportunity. I think I learned a lot from you too. It's always super interesting to talk to you. Thank you very much for this conversation. I think that this issue is very complex. Still, we're still learning. We're still understanding how to relate to that. But just one point that I would like to understand is that in the area of technology, we say technology in itself sometimes is the easiest or least complex part of it, of everything that we are talking about. The most complicated sometimes is behavior, culture, design, how we are really going to put them into people's lives. So just in closing, thank you very much once again. And that's it. Thank you. Dr. Alonso? Well, thank you very much. It was a pleasure to share ideas with you, Philip, Jose Carlos, and Bernardo. From the standpoint of Microsoft, and our technologies and capacities are available. We use open sources. We can have pilot studies. We have very attractive terms. And we can share experiences, and we have excellent experience with patients using AI. the reality is that this is here already today. It's an important methodology. There's an adoption process, and people need to benefit from that. If you want to democratize, we have a methodology to provide access and to protect privacy and to implement in this area. Thank you very much. Thank you, Dr. Alonso José Carlos. I would also like to thank you for the opportunity, Bernardo, Philip, Dr. Alonso. Dr. Alonso, it's a great pleasure for me to be here. And I would like to say that whenever I hear and talk about this theme of AI, I'm on a postdoc study on artificial intelligence, and there is a certain glamour when we talk about it, but it's important to demystify artificial intelligence. It's not so much true that there is a robot that it will learn everything and walk around and solve our problems. I think that the main issue is applicability. Can I apply it very well for the benefit of people, or was it the opposite? Would I cause harm to people? So the ethics and really regulating its use of these tools, which are very powerful, and they're gaining more and more utility. And all the best for us to lead more sustainable and democratic lives with more access. And that's it. This is my final message from our discussion here. Thank you very much. Thank you, everyone. Thank you, Felipe, Dr. Alonso, José Carlos. Thank you, FIS, for the initiative and for promoting this type of meeting. This is a very important meeting for us to share knowledge, to share realities, experiences. And I agree with you. We are going to grow in AI and health technology if we make it democratic. Bear in mind ethics and safety. This is very important. Always person-centered. Let's put the person at the center of all of this and find logic and meaning in everything that we are doing, so that that person, that individual will benefit. So I'd like to thank on behalf of Ask. Thank you very much. Have a good afternoon.
A Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força. A saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados. Unidos pela saúde.
O conhecimento transforma. A transformação te carrega para o futuro. Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
Bradesco Saúde desenvolveu uma série de iniciativas que promovem orientação e cuidado em meio à pandemia de Covid-19. É o Saúde Digital. Com ele, quem tem Bradesco Saúde pode realizar consultas médicas por videochamada sem sair de casa. Veja como funciona. Para dúvidas e sintomas de Covid-19 ou outras questões de saúde, você deverá acessar o app Bradesco Saúde. Se você ainda não tem instalado, faça o download gratuito na App Store ou no Google Play. Para consultas médicas regulares com médicos referenciados, acesse o site bradescosaude.com.br. Confira as especialidades disponíveis para atendimento por videochamada e como agendar sua consulta. Bradesco Saúde, ao seu lado contra o coronavírus.
É pra ficar junto.
Inspira.
É pra saber sua história. É pro seu estilo de vida. É pra olhar nos olhos. É pra cada fase da vida. A DASA é uma rede de saúde integrada que acompanha as pessoas ao longo da vida. DASA é pra toda a vida.
Para ser referência em medicina, é preciso ir além. É preciso ciência, método de pesquisa, fomentar conhecimento, compartilhar e formar talentos. Ao longo do tempo, investimos para termos o melhor corpo médico, as melhores instalações, a melhor equipe assistencial, a tecnologia mais avançada. É nisso que acreditamos. É isso que buscamos. Somos o Hospital Moinhos de Vento. Referência em medicina, referência em saúde.
The body is an amazing organism, designed to run marathons, think of ideas, and see a beautiful world. It's capable of complex tasks. But when the body is compromised by disease or disorders, disabled by trauma or wounds, it needs help getting better. And that's why we're here, to create medical technology that saves lives and changes lives. For the heart, the soul, the ambitions, and the dreams of every person we touch. We are here to innovate, to look at challenges from all angles, to follow patients beyond diagnosis, through treatment and recovery, to get them back to their best body, living their best lives, and being their best selves. Our ambitions are big. We are working to give people surgery without incisions, contact lenses that treat allergies, implants that monitor themselves, real-time maps of the heart. We are redefining what the body can accomplish. And even though we are a diverse group of businesses, we share a common goal: save lives and ignite all that's possible in everybody.
Super-heróis são seres com poderes mágicos que voam, que enxergam o que ninguém enxerga. Hoje, fica claro que vivemos rodeados de super-heróis, dirigindo, acolhendo, cuidando, que têm feito da proteção do outro sua missão. Eles sempre estiveram aqui, só estavam disfarçados. Homenagem a quem tem feito mais do que o seu trabalho para mais gente ficar bem. Mater Dei 40 anos.
Em 2021, o Prontuário Eletrônico do Paciente do SOMV, solução da empresa para o setor hospitalar, ganhou pela 6ª vez consecutiva o reconhecimento de melhor da América Latina, de acordo com o Instituto Norte-Americano CLES. Uma vitória que é nossa, de cada um que trabalha na MV. Quem faz o PEP sabe que por trás da solução tem muito esforço, dedicação e comprometimento. É por isso que esta conquista não é apenas da MV, é do Brasil, é nossa.
Nós nascemos na saúde e nos movemos pela saúde. Impulsionados por essa paixão, nos tornamos uma das maiores empresas de tecnologia para a saúde do Brasil. Nosso caminho é trilhado por 400 colaboradores e mais de 6.000 clientes. Somos tecnologia que evolui todos os dias. Somos Fixion.
Inspirar pessoas a cuidar de pessoas. Isso está conectado no olhar e no sorriso de quem é Sabin. De norte a sul do país, o jeito Sabin conecta você ao que existe de melhor em saúde integrada. Construímos pontes e histórias para contribuir com a comunidade, o meio ambiente e com um ecossistema empresarial mais humano, diverso e inclusivo. Seja aqui na sua casa ou na nossa casa, estamos de mãos dadas com a inovação e tecnologia para que a sua jornada de saúde seja completa. Grupo Sabin, presente e futuro conectados com a sua saúde.
Nascemos com o desafio de mudar o olhar para a saúde de cada pessoa, transformando informação em conhecimento. Tudo em um mesmo lugar, dados e serviços juntos para permitir pela primeira vez que cada um tenha a visão completa sobre sua saúde. Todos reunidos em uma plataforma, unindo forças para criar soluções extraordinárias e oferecer todo o cuidado que cada pessoa merece e precisa, de maneira coordenada e digital. Afinal, acreditamos que usar a tecnologia de forma inteligente e integrada é o primeiro passo para preservar o maior ativo de nossas vidas, a saúde. ID. Toda saúde é única.
THB é uma das maiores consultorias em saúde, benefícios, seguros, resseguros e affinity. Com foco em inovação e proximidade com o cliente, a THB tem uma equipe multidisciplinar, com consultores especialistas na estruturação e administração de programas customizados. Fundada em 1978, faz parte do grupo MODELOS, o maior wholesale broker dos Estados Unidos, e está presente em todo o Brasil. THB, soluções que vão além do seguro.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Just trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease, the best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós da Fena Saúde temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos, proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos, realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano e movimentamos mais de 3% do PIB.
Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues, enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud for healthcare.
Pronep Life Care, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Life Care já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2.000 pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica, investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos. Em pessoas que podem inovar e melhorar processos e serviços. E no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac, todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, environmental infection control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso Mercado Central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso Oasis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
A Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força. A saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados, unidos pela saúde.
O conhecimento transforma. A transformação te carrega para o futuro. Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
Bradesco Saúde desenvolveu uma série de iniciativas que promovem orientação e cuidado em meio à pandemia de Covid-19. É o Saúde Digital. Com ele, quem tem Bradesco Saúde pode realizar consultas médicas por videochamada sem sair de casa. Veja como funciona. Para dúvidas e sintomas de Covid-19 ou outras questões de saúde, você deverá acessar o app Bradesco Saúde. Se você ainda não tem instalado, faça o download gratuito na App Store ou no Google Play. Para consultas médicas regulares com médicos referenciados, acesse o site bradescosaude.com.br. Confira as especialidades disponíveis para atendimento por videochamada e como agendar sua consulta. Bradesco Saúde, ao seu lado contra o coronavírus.
É pra ficar junto.
Inspira.
É pra saber sua história. pro seu estilo de vida. É pra olhar nos olhos. É pra cada fase da vida. A DASA é uma rede de saúde integrada que acompanha as pessoas ao longo da vida. DASA é pra toda a vida.
Para ser referência em medicina, é preciso ir além. É preciso ciência, método de pesquisa, fomentar conhecimento, compartilhar e formar talentos. Ao longo do tempo, investimos para termos o melhor corpo médico, as melhores instalações, a melhor equipe assistencial, a tecnologia mais avançada. É nisso que acreditamos. É isso que buscamos. Somos o Hospital Moinhos de Vento. Referência em medicina, referência em saúde.
The body is an amazing organism, designed to run marathons, think of ideas, and see a beautiful world. It's capable of complex tasks. But when the body is compromised by disease or disorders, disabled by trauma or wounds, it needs help getting better. And that's why we are here, to create medical technology that saves lives and changes lives. For the heart, the soul, the ambitions, and the dreams of every person we touch. We are here to innovate, to look at challenges from all angles, to follow patients beyond diagnosis, through treatment and recovery, to get them back to their best body, living their best lives, and being their best selves. Our ambitions are big. We are working to give people surgery without incisions, contact lenses that treat allergies, implants that monitor themselves, real-time maps of the heart. We are redefining what the body can accomplish. And even though we are a diverse group of businesses, we share a common goal: save lives and ignite all that's possible in every body.
Super-heróis são seres com poderes mágicos que voam, que enxergam o que ninguém enxerga. Hoje, fica claro que vivemos rodeados de super-heróis, dirigindo, acolhendo, cuidando, que têm feito da proteção do outro sua missão. Eles sempre estiveram aqui, só estavam disfarçados. Homenagem a quem tem feito mais do que seu trabalho para mais gente ficar bem. Mater Dei 40 anos.
Em 2021, o prontuário eletrônico do paciente do Sobre, solução da empresa para o setor hospitalar, ganhou pela 6ª vez consecutiva o reconhecimento de melhor da América Latina, de acordo com o Instituto Norte-Americano CLES. Uma vitória que é nossa, de cada um que trabalha na MV. Quem faz o PEP sabe que por trás da solução tem muito esforço, dedicação e comprometimento. É por isso que esta conquista não é apenas da MV, é do Brasil, é nossa.
Nós nascemos na saúde e nos movemos pela saúde. Impulsionados por essa paixão, nos tornamos uma das maiores empresas de tecnologia para a saúde do Brasil. Nosso caminho é trilhado por 400 colaboradores e mais de 6.000 clientes. Somos tecnologia que evolui todos os dias. Somos Fixion.
Inspirar pessoas a cuidar de pessoas. Isso está conectado no olhar e no sorriso de quem é Sabin. De norte a sul do país, o jeito Sabin conecta você ao que existe de melhor em saúde integrada. Construímos pontes e histórias para contribuir com a comunidade, o meio ambiente e com um ecossistema empresarial mais humano, diverso e inclusivo. Seja aqui na sua casa ou na nossa casa, estamos de mãos dadas com a inovação e tecnologia para que a sua jornada de saúde seja completa. Grupo Sabin, presente e futuro conectados com a sua saúde.
Nascemos com o desafio de mudar o olhar para a saúde de cada pessoa, transformando informação em conhecimento. Tudo em um mesmo lugar, dados e serviços juntos para permitir pela primeira vez que cada um tenha visão completa sobre sua saúde. Todos reunidos em uma plataforma, unindo forças para criar soluções extraordinárias e oferecer todo o cuidado que cada pessoa merece e precisa, de maneira coordenada e digital. Afinal, acreditamos que usar a tecnologia de forma inteligente e integrada é o primeiro passo para preservar o maior ativo de nossas vidas, a saúde. ID. Toda saúde é única.
A THB é uma das maiores consultorias em saúde, benefícios, seguros, resseguros e affinity. Com foco em inovação e proximidade com o cliente, a THB tem uma equipe multidisciplinar, com consultores especialistas na estruturação e administração de programas customizados. Fundada em 1978, faz parte do grupo MODELOS, o maior wholesale broker dos Estados Unidos, e está presente em todo o Brasil. THB, soluções que vão além do seguro.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease, the best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós da Fena Saúde temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio
é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues, enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud for healthcare.
Life Care, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Life Care já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2 mil pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joy Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica, investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos. Em pessoas que podem inovar e melhorar processos e serviços. E no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender Fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac, todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, environmental infection control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso mercado central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força: a saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados, unidos pela saúde.
O conhecimento transforma. A transformação te carrega para o futuro. Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
Bradesco Saúde desenvolveu uma série de iniciativas que promovem orientação e cuidado em meio à pandemia de Covid-19. É o Saúde Digital. Com ele, quem tem Bradesco Saúde pode realizar consultas médicas por videochamada sem sair de casa. Veja como funciona. Para dúvidas e sintomas de Covid-19 ou outras questões de saúde, você deverá acessar o app Bradesco Saúde. Se você ainda não tem instalado, faça o download gratuito na App Store ou no Google Play. Para consultas médicas regulares com médicos referenciados, acesse o site bradescosaude.com.br. Confira as especialidades disponíveis para atendimento por videochamada e como agendar sua consulta. Bradesco Saúde, ao seu lado contra o coronavírus.
É pra ficar junto.
Inspira.
É pra saber sua história. seu estilo de vida. É pra olhar nos olhos. É pra cada fase da vida. A DASA é uma rede de saúde integrada que acompanha as pessoas ao longo da vida. DASA é pra toda a vida.
Para ser referência em medicina, é preciso ir além. É preciso ciência, método de pesquisa, fomentar conhecimento, compartilhar e formar talentos. Ao longo do tempo, investimos para termos o melhor corpo médico, as melhores instalações, a melhor equipe assistencial, a tecnologia mais avançada. É nisso que acreditamos. É isso que buscamos. Somos o Hospital Moinhos de Vento. Referência em medicina, referência em saúde.
The body is an amazing organism, designed to run marathons, think of ideas, and see a beautiful world. It's capable of complex tasks. But when the body is compromised by disease or disorders, disabled by trauma or wounds, it needs help getting better. And that's why we're here, to create medical technology that saves lives and changes lives. For the heart, the soul, the ambitions, and the dreams of every person we touch, we are here to innovate, to look at challenges from all angles, to follow patients beyond diagnosis, through treatment and recovery, to get them back to their best body, living their best lives, and being their best selves. Our ambitions are big. We are working to give people surgery without incisions, contact lenses that treat allergies, implants that monitor themselves, real-time maps of the heart. We are redefining what the body can accomplish. And even though we are a diverse group of businesses, we share a common goal: save lives and ignite all that's possible in every body.
Super-heróis são seres com poderes mágicos que voam, que enxergam o que ninguém enxerga. Hoje, fica claro que vivemos rodeados de super-heróis, dirigindo, acolhendo, cuidando, que têm feito da proteção do outro sua missão. Eles sempre estiveram aqui, só estavam disfarçados. Homenagem a quem tem feito mais do que o seu trabalho para mais gente ficar bem. Mater Dei 40 anos.
Em 2021, o prontuário eletrônico do paciente do Sobre, solução da empresa para o setor hospitalar, ganhou pela 6ª vez consecutiva o reconhecimento de melhor da América Latina, de acordo com o Instituto Norte-Americano CLAS. Uma vitória que é nossa, de cada um que trabalha na MV. Quem faz o PEP sabe que por trás da solução tem muito esforço, dedicação e comprometimento. É por isso que esta conquista não é apenas da MV, é do Brasil, é nossa.
Nós nascemos na saúde e nos movemos pela saúde. Impulsionados por essa paixão, nos tornamos uma das maiores empresas de tecnologia para a saúde do Brasil. Nosso caminho é trilhado por 400 colaboradores e mais de 6.000 clientes. Somos tecnologia que evolui todos os dias. Somos Fixion.
Inspirar pessoas a cuidar de pessoas. Isso está conectado no olhar e no sorriso de quem é Sabin. De norte a sul do país, o jeito Sabin conecta você ao que existe de melhor em saúde integrada. Construímos pontes e histórias para contribuir com a comunidade, o meio ambiente e com um ecossistema empresarial mais humano, diverso e inclusivo. Seja aqui na sua casa ou na nossa casa, estamos de mãos dadas com a inovação e tecnologia para que a sua jornada de saúde seja completa. Grupo Sabin, presente e futuro conectados com a sua saúde.
Nascemos com o desafio de mudar o olhar para a saúde de cada pessoa, transformando informação em conhecimento. Tudo em um mesmo lugar, dados e serviços juntos para permitir pela primeira vez que cada um tenha visão completa sobre sua saúde. Todos reunidos em uma plataforma, unindo forças para criar soluções extraordinárias e oferecer todo o cuidado que cada pessoa merece e precisa, de maneira coordenada e digital. Afinal, acreditamos que usar a tecnologia de forma inteligente e integrada é o primeiro passo para preservar o maior ativo de nossas vidas, a saúde. ID. Toda saúde é única.
A THB é uma das maiores consultorias em saúde, benefícios, seguros, resseguros e affinity. Com foco em inovação e proximidade com o cliente, a THB tem uma equipe multidisciplinar, com consultores especialistas na estruturação e administração de programas customizados. Fundada em 1978, faz parte do grupo MODELOS, o maior wholesale broker dos Estados Unidos, e está presente em todo o Brasil. THB, soluções que vão além do seguro.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease, the best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós, da Fena Saúde, temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos, proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos, realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano e movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues, enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud for healthcare.
Lifecare, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Lifecare já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2 mil pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica, investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos. Em pessoas que podem inovar e melhorar processos e serviços. E no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender Fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac, todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired.
The day-to-day is full of high-quality content. Please remember to tag FIS Week and the FIS Initiative on all social media. You just have to use the FIS Week hashtag. Oh, wait, before we start talking about the subject matter of the panel, I want to remind you that the Trust platform will continue on air after the FIS Week, and you can expect a lot of high-quality content there. So tell us, what's the subject that's waiting for us? Well, it will be improving access to health with economic recovery. That panel will be moderated by Dr. Marcio Coloriolano, the president of CNEG, with the participation of Carmen Soroka, State Federal Congresswoman in Santa Catarina, Jose Camargo from Cook Rio, and economist in chief of investments, Secretary of Economic Development, Science and Technology for the state of Sao Paulo. You can't miss that. Let's watch it. Hello, good afternoon. I'm Marcio, President of the National Confederation of Insurance Companies, NSEC. That's the acronym, but I must tell you the name. And deeply thankful for this initiative for having invited me to moderate this panel, which is about a topic. We'll talk about improving access to economic recovery. And with this, we'll have Carmen Noto, Jose Margo, and Patricia Ellen. She'll be joining us. She had some conditions, but she'll probably join us. Congresswoman office as a federal congresswoman, Catarina, the party, graduated in nursing and specialized in hospital administration and public health, human resources, and she has in politics for the policies for the first childhood from the University of Harvard, just Ohio. Sergio Camargo, chief at the General Bank, Dr. PhD in economics from Massachusetts Technology, and he's also a professor at the Department of Economics at the University of Rio de Janeiro. Patricia Ellen, she is Secretary of Science, Technology, and Economics in the state of Sao Paulo, and she graduated in administration in Sao Paulo, and she has a master's from Harvard. She was the president of Brazil, which is a healthcare technology company from the United Healthcare Group, among other activities. I'll try to save time since we don't have so much time. subject matter panel assumes that there will be an economic recovery. That is still dividing economists and their specialists and access to, because we're always to access. Access to health is what matters for citizens. Since the subject to access and economic development comes to me is healthcare funding, because without adequate, predictable funding, access to health is more difficult. And I'm talking about funding from two different perspectives, which are totally different. It's the funding of the public healthcare system to the private healthcare system. The funding of the public healthcare system is fiscal. Perspectives for economic recovery, and it happens speed at that should be at the budgetary execution of the federal government, the states and the municipalities that comprise the and the public resources. Well, the private healthcare system comes from the funding given by companies and families that purchase health insurance plans. So when we talk about economy, what the impacts that across industries, commercial and agricultural and service sectors. As a backdrop to approach that Brazil long periods of recession, specifically between 2015 and 2018, which was by exterior imbalance. Talking about this system, when the budget ends, again, it's static, but it's that simple. Criteria that must which criteria should the light system in the system their system, they do not admit light. How to compatibilize the costs of private medicine, which also inflation with the payment capacity of this insurance. Are other aspects of management that refers to use resources, the efficient use of resources, and private, even though it might seem that it's senseless that the funding of the system. Well, of course, these are suggestions for our discussion. Could address as if you'd be so kind. Congresswoman Carmen. Thank you very much. Great colleagues or Mr. Marcio, I want to be Professor just and Patricia probably join us. Used to say that the very subject of the discussion right now is challenging. because the subject says improving access to health with the recovery of the economy. That is our big expectation and our deepest desire, because we're still going through a much other COVID-19 scenario, but we should point out that at the public, probably in the private healthcare system, with the reverse demand that already existed before the pandemic, because it has accumulated the demands that were accumulated during the pandemic. So it's 20 months that we didn't use most of the procedures. %60 of people were having difficulty in accessing cancer prevention exams or mammograms. And with that, clinical cases must be much more complex. The expectations for the recovery of the economy, if we look at the other countries, in spite of the difficulties that we all have in understanding the importance of vaccination and in acquiring vaccines, that we already have approximately 60% of the Brazilian population with the 2 doses, with single dose. And that reflected in not having new waves or difficult moments as we're seeing in other countries in this period. And fortunately, we are increasingly reducing the number of deaths and the number of hospitalizations. And this leads us to believe that the recovery of the economy and job positions may be a factor that will be facilitated for us in Brazil. But my biggest concern, and the concern of several colleagues that work with health, is how can we deal with the repressed demands that accumulated over time in the healthcare sector? Because there were several users of private plans that abandoned their healthcare plans with the pandemic and migrated to the public healthcare system. So how can we make do with the budget that we were given? Just adjusting what had been applied in the previous year plus IPCA. What magic are we supposed to make? We're talking about complex procedures. We're talking about patients that need to have access to their diagnostic tests, their chemotherapy, their radiotherapy, oncological surgery, to medical referral, cardiac surgeries, and let's be frank, hernia surgery, for instance, that can be considered elective, but if it takes so long to have it, it can become complicated, become urgent. So this is the challenge ahead of us, which is to be sure that we'll have a sufficient budget according to Constitutional Amendment 95. And what's happening? Last week in Congress, there are discrepancies or not, but the PAC may be providing us with a bit more resources in healthcare, or a budget of 134 billion reais for next year may be added to maybe added to another 5 billion, which is important. It's not that I think that we shouldn't have criteria for spending, but we approved Constitutional Amendment 95, and we didn't that we couldn't make necessary the required changes. We are losing more and more professionals, especially in the healthcare departments that are abandoning healthcare services because their compensation is not adequate for what they do. So we might have more difficulty if we continue to lose professionals, or if the hospitals no longer carry out procedures due to budgets. An additional 5 billion in the healthcare budget. I consider that to be important, as well as the resources that should be allocated for us to guarantee the acquisition of more vaccines for next year and strategic assets to fight the pandemic. So with the recovery of the economy, we wish and we also believe that the population may return to health insurance plans, but we're so uncertain due to the general difficulties that the population of Brazil has been facing. We just have to look at the news, Brazilians running after trucks with bones to feed their families, which is really, really sad. There are several things that we have to fight, but we should also leverage the suffering and the loss of life to innovate in healthcare. That's why I believe that part of the challenges will involve consolidating telemedicine, because we're authorized to do telemedicine during the pandemic, but we have to change the legislation and allow remote appointments to continue to happen and to help with the lack of specialists, because it's not only about access to high and medium complexity procedures that we need. We also need specialized medical appointments, and that's very important. And using the equipment that was acquired, such as ICU beds for COVID, to maintain general hospital beds, and also expand the number of neonatal hospital beds and pediatric beds in regions where there are specialists we didn't have yet. But these are important changes in neonatology that is also a challenge that we have to understand and that we have to face. So this equipment should not become waste. It has to become an asset that should be used and maintained and used to expand and create new general hospital beds, both for adults and children and neonates. Another aspect, and we're here with Professor Marcio and Patricia, is how the Brazilian industry to reinvent itself so that we no longer depend on strategic assets such as a simple mask, and so that we're a bit more independent from basic assets of other countries in terms of basic assets. That's my first concern. And I want to highlight this and say that we have to transform all this suffering and loss of lives, recognizing the importance and looking for secure funding and to believe in our institutes such as Fiocruz and strengthen research in Brazil. Without a doubt, without strengthening these sectors, access to health will become harder. Strengthening our researchers and research in the country undoubtedly also needs to be the legacy of this pandemic, so that we can reduce the lines of the public health system and also healthcare plans, because it's a reality. The lines are also long, and also the difficulty of access. Thank you very much. Congresswoman, apparently you're controlling your words because you're precisely on time. Thank you very much for your excellent participation. And at the same time, I will now straight I'll give the floor straight to our friend, economist Camargo. Thank you. It's a pleasure to be here at the FIS initiative and our scenario for representing the economy 2022. That's what I want to discuss, and also talk about how financing. Well, what we've been doing is, well, I think one good way to see it is that it's a very challenging scenario. There are two complicated things for the Brazilian economy for 22 that we'll have to deal with in the best possible way. What we've been doing is we've been doing our forecast based on three important pillars. One, respecting the cap on the public expenses. Why is that important to do that? Because this cap gives fiscal credibility to the country. What does that mean? It means that when you have a cap for public expenditures, whenever you have an increase in revenue, this increase in revenue cannot be used to increase expenses. It has to be used to decrease the debt, and that makes the debt sustainable in the long run. The result of that is that investors ask for a lower interest rate to fund the debt, and consequently, the cost of funding the debt essentially drops. To give you an idea, before the cap in 2015, the interest rate of the public Brazilian debt was on average 20% per year. Before the crisis, the rate dropped to 5% per year. There was inflation. Now it's a bit higher. There is this entire discussion about the cap, and this decreases credibility. And since it decreases credibility, investors ask for a higher interest fee to fund the debt, and part of the resources is used to fund the debt. The second important pillar in our scenario is this improvement in the pandemic. According to our assessment, if we continue in this path of improvement in the pandemic, and our expectation is that we will remain in that trajectory wherein Brazil has vaccinated most of its population, so we'll really continue to reduce the number of cases and deaths. We expect that people will be extremely euphoric to go back to normal. People will be crazy to go out, be with friends, have a dinner, and in summary, it's already happening. I don't watch soccer games, but I've been watching lots of soccer games on TV, and it's really pleasant to see how happy people are at the stadiums, discussing and talking to street vendors and so forth. And our assessment is that it will lead to a huge growth in the demand for services. Services are workforce intensive, and it will generate a huge increase in the use of the workforce. So between the first quarter of 2021 and the last data of unemployment, there's a drop from 14.7% to 13.2%. So our assessment is that we're going to reach year's end with an unemployment rate very close to the one that we had before the pandemic, which will really decrease inequality, especially poverty. And that's another very important aspect. And the third pillar, which is also positive, is the return of private investments. the concession auctions, the privatization auctions carried out by the state and federal governments are extremely successful. We saw the privatization of Sinai and the sewage water system of Alagoas, the sewage and water system of Amapá, the privatization of five highways, the Dutra, the new regulatory framework of railroads. There are 24 demands for the construction of new railroads. So to summarize, there's a huge increase in investments going on in terms of these concessions, which is to say that Brazil is now becoming attractive again as a private capital. So all these things are a positive side, except for the pillar of the expenditure cap that was assessed this week. But there's another aspect which is very complicated, which is inflation. We have an accelerating inflation, and it's very hard to fight it. And an important part of this inflation is exogenous things to the global economy. It's a global problem. It's not only in Brazil. There's an increase in several prices. The production chains are having huge problems. We have problems related to a lack of materials and excessive demands, and the supply is not able to keep pace with that, and that's leading to inflation and increased interest rate. And this will lead to a reduction in attractiveness in 2022. Our scenario predicts a growth rate of 5.2% in 2021 and 12% in 2022, with an inflation of 9% in 2021 and 5% in 2022. Now, I want to dedicate the rest of my time to talk about the expenditure cap and healthcare funding, which is extremely important. Constitutional Amendment 95 that created the cap for public expenditures has an extremely goal. For the very first time, Brazil has a budget that deserves the name budget. Because for the first time, the Brazilian public budget has a cap up until the approval of Constitutional Amendment 95. The public budget in Brazil has no limit. The way it works was that a goal, primary superrabbit, the government would send to the Congress a budget, the primary superrabbit goal. The Congress would increase the revenue expectations, and as a consequence would increase revenues and approve the primary surplus goal with higher expectations for revenue and expenses. New revenues would not always happen, but that was the case. This increased expenses were funded either by increasing inflation. We had several inflations in Brazil, or by increasing tax burden. We had a very important increase in the tax burden in the last few years, or by increasing our debt. Our debt increased systematically since re-democratization till 2017. So these three factors no longer exist. Society no longer accepts inflation. Society no longer accepts increased tax burden. And creditors no longer accept funding the Brazilian debt. Now we have a cap. Just to say that, and I want to draw your attention to this. As of now, whenever you hit the cap, you got to choose your priorities. And it is fundamental for agents to understand that the scenario has changed. The way we receive budget has changed. In the past, we simply incorporate more expenses and then find out how to pay them. But now that's no longer possible. Now we have to convince the society that it is fundamental for you to have a higher budget in healthcare, even if it has to be taken from elsewhere. So once additional budget for healthcare, in addition to the minimum established by Constitution 195, it's fundamental for agents to be capable of arguing for the importance of a budget for health. And the same thing applies to education and not. There's a structural change in the way budget is set up in Brazil, and this results from the existence of a cap. But we'll have to get used to that as of now. And as long as we have the ceiling, when we hit the ceiling, we'll have to learn to justify our demand for an increase in expenditures, whether it is health, education, or anything else. I think that's an important aspect because it's very important for agents to be able to voice their argument as part of democracy. It's very important for us to be always ready to discuss the budgetary demands. So, well, this is my first presentation. I'll be available to you again. Thank you, and Secretary, welcome again. We were able to connect to our meeting. You probably were here watching most of his speech. That's self-explanatory. That was preceded by a speech where Congresswoman talked about the times ahead of us, and that was expected. This may become a dramatic situation with the full recovery of elective services and the request demands that entails. I mean, the challenges. She also associated that to good management of budgets and efficiency restrictions. So I want to take the opportunity and please to make your comments. I just want to remind everybody, it doesn't matter if we're talking about the expenditure cap, that our public health system is tripartite. I remember in the past when it was created, that it was called SUGE before it was SUGE, the Unified Centralized Healthcare System.
There was a more important role for the union in terms of managing the resources, and you as a secretary must know very well what it means, and perhaps we could better explore it. How can we deal with it in such a critical moment we're going through in the country? And how would you use more efficiency in this relationship with the states and municipalities? Secretary, the floor is yours and you have 10 minutes. Well, thank you very much. Thank you, José Márcio, and I also thank the Congresswoman. I'm sorry I was connected and then disconnected. I was on my way coming back from the city of Sorocaba. In the city of São Paulo, it feels like winter time. It is, we have torrid rains and very cold weather, and this is probably the effect of climate change. And when we talk about the chronic diseases, we have other tropical diseases in addition to infectious, contagious diseases, which we've been dealing with during the pandemic. I was recently in the Amazon. They have a malaria event now. It not only for their public healthcare system, but I'm not familiar with any system in the world that has three simultaneous challenges that are so significant. So we age before we prosper. We have an incidence of chronic diseases that is observed in countries whose life expectancy is much higher, such as Japan and others. And then we have the third pillar, which are the external causes such as violence, traffic. During the pandemic, we had a small reduction. Mostly this was due to external causes, and we also have had an increase in other causes of mortality, such as women abuse and crime against women. That's a very peculiar challenge in our country, and therefore we have three systems in one that we have to face. During the pandemic, we were tested to our extreme, and we realized how important it was to have a unified healthcare system. With our public healthcare system here in Brazil today, we have reached the records of vaccination speed that were not achieved in countries that started before we did. We also had an opportunity to expand our coverage in ICU beds. We also were able to get away with some paradigms. Things happened very quickly. They were all induced by the pandemic. In the case of São Paulo State, in the beginning of the pandemic, we had 3,500 ICU beds. And we reached the end of the pandemic with a totally different number. And a lot of what we did, we had to redo. Governors were let afloat. We had delays in the payment of federal funds. And in the case of São Paulo, what the governor did from the very beginning was something that many people called very daring or crazy. We had an administrative reform during the pandemic, but that was very important because we were able to save expenses and had an increase in our collection. We have just launched another program, and we have a huge ability to invest at 13.3%, which is twice as much of what we had when we started our administration. There's no other country in the world with an accelerated resumption if they do not use technology and innovation. Here, as president of the National Council of Technology, we have a very worrisome situation. We have the lowest budget, and it was reduced to a third of what it was 2 years ago. In the case of the São Paulo State, we had an increase of 40% in 2 years, and this is the highest increase we've had. This is very important to guarantee that we will have vaccines, vaccine manufacturing, telemedicine, applied technology, in different fronts. The respirators, they were developed by the University of São Paulo. Today, I checked the latest statistics. We had 900 machines distributed to 17 states in the country, and therefore, we know that investing in science and technology and investment in healthcare system is not to be negotiated. I was proud to see that the week before last, we were in the Arab Emirates, and that's the country with the highest level of vaccination in the world. They have reached almost 90% of their overall vaccination. The state of São Paulo is the Brazilian state that is leading with the same percentage of vaccination and a complete vaccination system. We reached 72% of our overall population and 84% of the adult population. But in the Emirates, they distributed less than half of the vaccines we do here in São Paulo. We're talking about 74 million vaccines that have been administered. This can only be done when we have a system in place. I'd like to highlight this integration between states and municipality because the administration is done at a local level. We had to do unexpected things. To summarize, here in Brazil, we're going through a very concerning period. We do not have a macroeconomic policy. We do not have investments. With that, we do not allocate resources efficiently and are going through the chaos we can see right now with a lot of inflation and other problems we didn't have in the past. Unfortunately, we have to go through all of this again. I have traveled to the inner parts of the country, and it's very sad to see the inflation going up. I remember as a child, the currency would change. We always had an inflation. You had the money to buy your bread at the end of the beginning of the day, and then the next day, that money was not enough to buy bread. And so right now we have a very worrisome situation where we've had more inflation than we had in the last 15 years. We also had to improve efficiency by investing in technology and innovation. What happened with the governors of the municipalities I witnessed in my case was that we had to use our own resources to add to their budget. The governor personally headed a solidarity business committee with where we had over 35 meetings. We obtained 2 billion BRLs, and many of the resources we could not apply directly, including to purchase vaccine and tests and to buy masks. We used these private resources in this war operation we had during the pandemic. São Paulo state is going to grow over 7% this year. São Paulo has grown at higher rates than the rest of Brazil in the last 3 years. So what is the main concern now? We have to fight inequalities, but one state alone cannot solve our problem. We have to solve the problem for the whole country. We are receiving the same amount of immigrants we received decades ago. So if you walk around the city in São Paulo, you will see record numbers of people living in the streets, not only from our own country, but from neighboring countries. All this growth is not going to be enough, but this is something that we have to do. We must leverage new technology so that we can give the next step forward. We are advancing with telemedicine. You're probably following up. We are using private equipment at nighttime. And because this bridge between the state and a federative pact is not working very well, we hope to strengthen the relationship between the state and the municipalities. Also, public-private initiative bonds. If we do not work in an integrated manner, we will not be able to face the challenges we have ahead of us. Thank you very much. Well, thank you, Secretary. We have about 15 minutes. I know it's not enough. It's little. I'm going to make a proposal here. I will gather some observations, combine them into a set of questions. We have had some coincidences in what you mentioned, but we also had some disagreements. So I will ask our Congresswoman the following question, actually because she talked about public budget. If I understood you well, we have an expectation to have 150 billion BRL in the budget for the public healthcare system next year. I was not able to confirm this data, but that corresponds to the same volume that was collected by the Brazilian system. So the private healthcare system has the same amount of resources to cover for 25% of our population. With the same amount of money, the public healthcare system will have to take care of 75% of our population. Of course, we have higher costs, and we also have costs that cannot be paid by service providers. And this leads to a total dearrangement, but this is our reality. On the other hand, the secretary has clearly mentioned now the question is the following. To obtain resources, we must have synergism between the federal and state and local systems, of course. And that is regardless of the political party, religious preference. It doesn't really matter. It is what Josias talks about all of the time. We need to think of all of our needs. So how do you see the possibility of resuming a pact, which is really a pact, and leaving aside our political and religious beliefs? And also, as Patricia said, how, because, integrating, unifying, that's something I do not believe in. We cannot integrate private and public systems, but some kind of collaboration, or in practical terms, we should have. And then Camargo is also free to comment upon what I just said. So now, Congresswoman, please. Well, I wanted to greet Patricia virtually because in the very beginning, when I joined, you were disconnected and then connected again. I'd like to say that I'm very optimistic about the public healthcare system. During the pandemic, it proved its worth, its capacity, despite any divergences. Everything was maintained. We did have some difficulties, but local and state level secretaries continued having their meetings. And this is another legacy that we must keep. If it weren't for our public healthcare system, we would not have had 60% of our population vaccinated. Yes, we did have difficulties, challenges in the purchase of the vaccines, but the actions of our employees in the 3 levels of government was very important. They worked hours and hours, and the number of ICU beds, there was a point in time where we had 24,000 ICU beds. This is the result of our joint efforts. There was a time when we were not able to purchase the equipment. The private initiative reinvented itself. We had companies that changed their plants and started manufacturing the respirators. And this is part of the support we had initially. Also has to do with funding by the private initiative, which supported our public healthcare system. So the tripartite issue is something that cannot change in our public healthcare system. Even if we know that today some municipalities are investing in healthcare. Some towns are investing 25% of its resources because that's where our citizens go to. And here, I would like to say something, and I'm not challenging you, Marcio. I am talking here as a nurse. I know that nobody can spend more than what they collect, but we cannot have a cap that would prevent us from moving on with what is essential. In other words, people's lives. To be able to deal with all of this, and our budget is really doing what our constitution amendment says. We have 84 billion, which will be invested in the prior year, plus IPCA. Our additional margin, the 25 million, because we changed the rules between June and July, and now it's from December and January. And the other resources, the 15 billions, which should be dedicated to buy vaccines for next year, so that we can continue our vaccination program. So this is our expectation and our hope. For us to be able to do this, we need, and Patricia mentioned it as well, we need to have the elective surgeries, specialized visits, and testing, because we're talking about a network here. If I do not have a visit with a specialist, I will not be able to close the diagnosis, and I will not be able to provide the care I need with the surgeries or other required procedures. Our challenges are many. That's why restarting is very important. Our public healthcare system is so important, and Brazilians trust vaccines so much that I do not think we are going to go through what other countries are. They have vaccines available, but they do not want to go get their vaccines with the booster doses. And I don't think they should be used for the elderly only, not only for those over 60 years of age and those with comorbidities. We will soon have to include every age group in the booster dose regimen. I'm very optimistic. I support our public healthcare system, and I believe that we can always improve our management, but management alone without further resources will not be enough. Thank you very much. We now have another challenge, Jose. It's a huge challenge. We only have 7 minutes. So it's almost like enough for you to say hello and goodbye. Okay. Well, the program is very simple. We have a public budget of 1.7 trillion BRL, more or less, of which 160 goes to healthcare, as we just mentioned, approximately 10%. Isn't there a way to give more to healthcare and removing it from other areas? Because there is 92% of our budget that is dedicated to other areas. Is healthcare really that unimportant, or do you have to increase the overall expense of the public sector so that we can supply for the needs of healthcare? And this is a challenge that we've been going through since democratization. This is an important issue. So why, in the case of the Brazilian budget, if healthcare is so important, why do we only give 10% of our budget to such an important thing? This is the question here. We should dedicate a larger part of our budget to healthcare. It doesn't mean that we have to increase the overall expense. We should dedicate a larger part of our budget to healthcare. Before I turn over to Patricia, Zé, I wanted to make a question. This is something that, this is a global issue. The best healthcare system in the planet, the British system, NHS, has 5,200,000 Britons in the wait line waiting to have their procedures done. And the problem there is that the tax coverage is not enough in England. Their population is older and the aging rate is much higher than in Brazil and in other European countries. This is a complex issue. Secretary, please. This is the same old challenge. And this is the discussion we should be having, actually, and this is not what is happening, unfortunately. The discussion today is more in terms of going beyond our cap. We're not focusing on the main strategies, policies, and priorities. And this is what our expectation is. I corroborate what was mentioned before by Carmen and José Márcio. Healthcare is very important. I'd like to remind you that the pandemic exacerbated our reality of inequalities throughout the country. The problems we're having in healthcare, we're unfortunately facing in education. Children did not go to school. They had to stay home. They have a huge gap. If this were an education panel, we would reach the same conclusion. We need more resources for education. But the problem is we do not have a macroeconomic policy because we're always pushing here and there and people are getting squeezed. But what do we do with lower and lower shares? In the case of healthcare, and in the book I wrote with Professor Zotenberg about digital revolution in healthcare, 2 years ago, we had this challenge. If you have a simulation of the amount of resources we have and quality improvement, it means that with the current cost we have per inhabitant today, our healthcare expenses correspond to 10% of our GDP, if we include public and private sectors. And to do it in an optimal manner, we would have to dedicate 25% of our GDP, and we know that this is not feasible, and that's why I'm talking about investing in technology and innovation. I always tell the story of telemedicine. I've been telling the same story for years now. It doesn't really change. We had a huge advance in popularizing telemedicine in the state of São Paulo. Now we have a model with specialists and generalists on the other side, but there are also legal challenges. And this is something that must be solved. We've already talked about different technical issues, and I'm going to wrap up in a kinder way. Numbers are not people. I have a very large family, and I can see the reality of my family going through the pandemic and the reality of a large part of my family. Those who had COVID had good care, but they went without seeing their family members for days and days. In the private healthcare system, everybody had access to their own doctors. When they were in the hospital, if I had any doubts about symptoms, I would have a video call with the pediatrician of my girls. They would ask me for testing, and I would take them to get their tests done. Why don't poor people deserve the same kind of service? we could solve many of the problems without having to spend more of our GDP. We need a macroeconomic solution, and beyond that, we need technology and management. That includes political will and a commitment towards inclusion. I agree, the public healthcare system is very successful. Without it, we would not have had the same vaccination rate. Brazilians, even with all the fake news, went out and got their vaccines, their shots. I think that if we do not do anything right now, we'll be creating an even bigger problem, though. We will need decades to solve it. Very well. This is great. Thank you very much. We're just a bit late. I don't think Josias will be very angry at us. I would like to thank you on behalf of Carmen, Zaroto, José Márcio, and Patricia for their excellent comments. I know that this debate will not be over here. We need more dedication from our public personalities. I thank you for your comments. And we're now going to say goodbye to those who have been here with us. Okay, so quickly, once again, I'd like to thank you for the opportunity to be here discussing such an important topic. And it's important that we renew our hopes for those who need us so much. José Márcio, your mic is muted. I wanted to thank you for the opportunity to be here discussing such an important issue. I hope that with the end of the pandemic, we'll be euphoric. I hope the next year will be a happier year. Everybody going out together, talking to their families, getting together, playing soccer. I think that this would be a perfect way for us to resume our economy in 2022. And I hope that we're able to develop a new budget culture, which will be essential for us to have long-term growth in Brazil. Thank you very much. Secretary, I would also like to thank everybody. I wrap up reinforcing the importance of using new technologies, the importance of having a budget to science and technology. And I would also like to thank the professionals in these areas who were dedicated despite the scarce resources. Their work was very inspiring in this process. And also the population in general. Brazil does not have problems with fake news regarding healthcare. This is beautiful. Brazilians do not discuss their health ideologically. They can do so for other things, but in healthcare, that's a priority. Employment is another priority, and this is an asset. It makes us optimistic. It's an opportunity to use our resources in a more effective way, leveraging technology so that we're more and more inclusive and human. Once again, congratulations for your work to the FIS organizers as well. Okay, thank you very much. Goodbye.
A Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força. A saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados. Unidos pela saúde.
O conhecimento transforma. A transformação te carrega para o futuro. Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
Bradesco Saúde desenvolveu uma série de iniciativas que promovem orientação e cuidado em meio à pandemia de Covid-19. É o Saúde Digital. Com ele, quem tem Bradesco Saúde pode realizar consultas médicas por videochamada sem sair de casa. Veja como funciona. Para dúvidas e sintomas de Covid-19 ou outras questões de saúde, você deverá acessar o app Bradesco Saúde. Se você ainda não tem instalado, faça o download gratuito na App Store ou no Google Play. Para consultas médicas regulares com médicos referenciados, acesse o site bradescosaude.com.br. Confira as especialidades disponíveis para atendimento por videochamada e como agendar sua consulta. Bradesco Saúde, ao seu lado contra o coronavírus.
É pra ficar junto.
Inspira.
É pra saber sua história. É pro seu estilo de vida. É pra olhar nos olhos. É pra cada fase da vida. A DASA é uma rede de saúde integrada que acompanha as pessoas ao longo da vida. DASA é pra toda a vida.
Para ser referência em medicina, é preciso ir além.
É preciso ciência, método e pesquisa, fomentar conhecimento, compartilhar e formar talentos. Ao longo do tempo, investimos para termos o melhor corpo médico, as melhores instalações, a melhor equipe assistencial, a tecnologia mais avançada. É nisso que acreditamos. É isso que buscamos. Somos o Hospital Moinhos de Vento. Referência em medicina. Referência em saúde.
The body is an amazing organism, designed to run marathons, think of ideas, and see a beautiful world. It's capable of complex tasks. But when the body is compromised by disease or disorders, disabled by trauma or wounds, it needs help getting better. And that's why we're here, to create medical technology that saves lives and changes lives. For the heart, the soul, the ambitions, and the dreams of every person we touch. We are here to innovate, to look at challenges from all angles, to follow patients beyond diagnosis, through treatment and recovery, to get them back to their best body, living their best lives, and being their best selves. Our ambitions are big. We are working to give people surgery without incisions, contact lenses that treat allergies, implants that monitor themselves, real-time maps of the heart. We are redefining what the body can accomplish. And even though we are a diverse group of businesses, we share a common goal: save lives and ignite all that's possible in everybody.
Super-heróis são seres com poderes mágicos que voam, que enxergam o que ninguém enxerga. Hoje, fica claro que vivemos rodeados de super-heróis, dirigindo, acolhendo, cuidando, que têm feito da proteção do outro sua missão. Eles sempre estiveram aqui, só estavam disfarçados. Homenagem a quem tem feito mais do que o seu trabalho para mais gente ficar bem. Mater Dei 40 anos.
Em 2021, o prontuário eletrônico do paciente do SOMV, solução da empresa para o setor hospitalar, ganhou pela 6ª vez consecutiva o reconhecimento de melhor da América Latina, de acordo com o Instituto Norte-Americano CLES. Uma vitória que é nossa, de cada um que trabalha na MV. Quem faz o PEP sabe que por trás da solução tem muito esforço, dedicação e comprometimento. É por isso que esta conquista não é apenas da MV, é do Brasil, é nossa.
Nós nascemos na saúde e nos movemos pela saúde. Impulsionados por essa paixão, nos tornamos uma das maiores empresas de tecnologia para a saúde do Brasil. Nosso caminho é trilhado por 400 colaboradores e mais de 6.000 clientes. Somos tecnologia que evolui todos os dias. Somos Fixion.
Inspirar pessoas a cuidar de pessoas. Isso está conectado no olhar e no sorriso de quem é Sabin. De norte a sul do país, o jeito Sabin conecta você ao que existe de melhor em saúde integrada. Construímos pontes e histórias para contribuir com a comunidade, o meio ambiente e com um ecossistema empresarial mais humano, diverso e inclusivo. Seja aqui na sua casa ou na nossa casa, estamos de mãos dadas com a inovação e tecnologia para que a sua jornada de saúde seja completa. Grupo Sabin, presente e futuro conectados com a sua saúde.
Nascemos com o desafio de mudar o olhar para a saúde de cada pessoa, transformando informação em conhecimento. Tudo em um mesmo lugar, dados e serviços juntos para permitir pela primeira vez que cada um tenha visão completa sobre sua saúde. Todos reunidos em uma plataforma, unindo forças para criar soluções extraordinárias e oferecer todo o cuidado que cada pessoa merece e precisa, de maneira coordenada e digital. Afinal, acreditamos que usar a tecnologia de forma inteligente e integrada é o primeiro passo para preservar o maior ativo de nossas vidas, a saúde. ID. Toda saúde é única.
THB é uma das maiores consultorias em saúde, benefícios, seguros, resseguros e affinity. Com foco em inovação e proximidade com o cliente, a THB tem uma equipe multidisciplinar, com consultores especialistas na estruturação e administração de programas customizados. Fundada em 1978, faz parte do grupo MODELOS, o maior wholesale broker dos Estados Unidos, e está presente em todo o Brasil. THB, soluções que vão além do seguro.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso Mercado Central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
A Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força. A saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados, unidos pela saúde.
O conhecimento transforma. A transformação te carrega para o futuro. Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
Bradesco Saúde desenvolveu uma série de iniciativas que promovem orientação e cuidado em meio à pandemia de Covid-19. É o Saúde Digital. Com ele, quem tem Bradesco Saúde pode realizar consultas médicas por videochamada sem sair de casa. Veja como funciona. Para dúvidas e sintomas de Covid-19 ou outras questões de saúde, você deverá acessar o app Bradesco Saúde. Se você ainda não tem instalado, faça o download gratuito na App Store ou no Google Play. Para consultas médicas regulares com médicos referenciados, acesse o site bradescosaude.com.br. Confira as especialidades disponíveis para atendimento por videochamada e como agendar sua consulta. Bradesco Saúde, ao seu lado contra o coronavírus.
É pra ficar junto.
Inspira.
É pra saber sua história. É pro seu estilo de vida. É pra olhar nos olhos. É pra cada fase da vida. A DASA é uma rede de saúde integrada que acompanha as pessoas ao longo da vida. DASA é pra toda a vida.
Para ser referência em medicina, é preciso ir além. É preciso ciência, método de pesquisa, fomentar conhecimento, compartilhar e formar talentos. Ao longo do tempo, investimos para termos o melhor corpo médico, as melhores instalações, a melhor equipe assistencial, a tecnologia mais avançada. É nisso que acreditamos. É isso que buscamos. Somos o Hospital Moinhos de Vento. Referência em medicina, referência em saúde.
The body is an amazing organism, designed to run marathons, think of ideas, and see a beautiful world. It's capable of complex tasks. But when the body is compromised by disease or disorders, disabled by trauma or wounds, it needs help getting better. And that's why we're here, to create medical technology that saves lives and changes lives. For the heart, the soul, the ambitions, and the dreams of every person we touch. We are here to innovate, to look at challenges from all angles, to follow patients beyond diagnosis, through treatment and recovery, to get them back to their best body, living their best lives, and being their best selves. Our ambitions are big. We are working to give people surgery without incisions, contact lenses that treat allergies, implants that monitor themselves, real-time maps of the heart. We are redefining what the body can accomplish. And even though we are a diverse group of businesses, we share a common goal: save lives and ignite all that's possible in every body.
Super-heróis são seres com poderes mágicos que voam, que enxergam o que ninguém enxerga. Hoje, fica claro que vivemos rodeados de super-heróis, dirigindo, acolhendo, cuidando, que têm feito da proteção do outro sua missão. Eles sempre estiveram aqui, só estavam disfarçados. Homenagem a quem tem feito mais do que seu trabalho para mais gente ficar bem. Mater Dei 40 anos.
Em 2021, o Prontuário Eletrônico do Paciente do Sobre, solução da empresa para o setor hospitalar, ganhou pela 6ª vez consecutiva o reconhecimento de melhor da América Latina, de acordo com o Instituto Norte-Americano CLES. Uma vitória que é nossa, de cada um que trabalha na MV. Quem faz o PEP sabe que por trás da solução tem muito esforço, dedicação e comprometimento. É por isso que esta conquista não é apenas da MV, é do Brasil, é nossa.
Nós nascemos na saúde e nos movemos pela saúde. Impulsionados por essa paixão, nos tornamos uma das maiores empresas de tecnologia para a saúde do Brasil. Nosso caminho é trilhado por 400 colaboradores e mais de 6.000 clientes. Somos tecnologia que evolui todos os dias. Somos Fixion.
Here. we'd like to thank the translation booth apologizes. The speakers are breaking up. Good afternoon, everybody. We had a small audio glitch with our presenters, but I'm here to tell you what they said. They were saying, thank you very much, Ricardo Brumovai. Thank you very much, Francisca Darcy de Oliveira. Thank you very much, Joaquim Falcão. You really honor the ending to our meeting with your participation, such illustrious guests who are so generous in sharing your knowledge, your skills. We have over 20,000 people enrolled in our FIS week that will be closing today with this panel. It was an intense week full of discussions, full of content, with a huge contribution that we all gave to improve the quality of hospital and medical care in Brazil. We brought specialists from several different industries, not only health, but also from economics, transportation, logistics, retail, from every segment of economy and society to share with us their experiences and the ones that could be incorporated by healthcare to improve what really matters, which is access. That's always what's on our minds, how to guarantee access of the Brazilian population to medical and hospital care with high quality. In closing this week, I would like to reiterate our deepest respect to healthcare professionals who, during the pandemic, dedicated so intensely to treating their patients in often hostile environments with no access to PPE, exposing their lives to protect ours. As a medical doctor, I'm really proud of my colleagues who were at the front line, providing assistance to the population, not only doctors, but also nurses, technicians, psychologists, nutritionists, pharmacists, physical therapists, clerks, receptionists, the stretcher carriers, extremely important, ambulance drivers who were instrumental for us to be able to give support to patients in need. Thank you very much to everybody who worked during the pandemic. and supermarkets, garbage trucks doing at-home garbage collection, pharmacies, food delivery professionals, people who allowed us to have access to all of these services. So a heartfelt thanks to all of you. And with that, we will now start our meeting, ending this FIS week. But before I do so, I want to thank the dozens of people working backstage to make FIS week a successful event. So I want to offer you my standing ovation for that. And with that, I want to introduce to you our honorable guests, Professor Rosiska Darcy de Oliveira, a dear friend and an extremely intellectual person, a member of the Brazilian Academy of Letters, a renowned writer. She is a unique personality that deserves our deepest respect and admiration, and especially my heartfelt thanks to you, Rosiska. We also have with us Professor Joaquim Falcão, who is half from Rio, half from Olinda. He was born in Rio, but his soul, his background belongs in Pernambuco, especially in Olinda. So he's constantly taking the shuttle service, and I found that out during Carnival. He was the founder of a Carnival band during his youth in Olinda. He is an extraordinary person with an extremely high quality intellectual content, a great writer, and a member of the Brazilian Academy of Letters. And last but not least, Professor Ricardo Abramovay, an economist with the unique characteristic of being a contemporary man who respects society, who is always trying to find the means to find social responsibility for the economy. Thank you very much. He's a great professor at the University of São Paulo. Thank you very much, Professor Ricardo Abramovay. Thank you very much, Professor Rosiska Darcy de Oliveira, and thank you very much, Professor Joaquim Falcão. We'll start our meeting talking about the ethical challenge of combining economics, science, and humanism with Professor Joaquim Falcão. The floor is yours, Professor. Thank you. Thank you, and congratulations on the initiative. Josier is a leader of his profession and of medical education in Brazil. We'll talk about combining science, ethics, and humanity. Ricardo Abramovay is a very rare specimen in that he is an economist who's also humane. He has nothing to do with the orthodox financial aspects that brought us where we are now. So it is a pleasure to be here standing by him and Rosiska, my dear friend throughout my life from the Academy of Letters. And she is a very prominent name in terms of the ethical conduct that we must adopt in society. So I was left with science, and I was left with discussing how to combine science, ethics, and humanity. So I'm going to do that in a very short manner. I have one message, and this is my main message to you tonight. Each civilization, and this is the civilization of the 21st century, each civilization has a different goal. Rome I'll start far away from us, but that's going to be quick. In Rome, their goal was to conquer territories through its armies. After that, the main goal of the Greek civilization was art, philosophy, and understanding the human being. The Phoenicians, their goal was trading and expanding trade through the oceans. And what is the purpose of our current civilization? Well, the current civilization, its main purpose is to achieve more life, more wealth, which equates to greater well-being and more justice. But we want to reach these goals, more health, justice, and wealth, differently from others. It's not through the armies or trade expansion, but rather it will be through scientific knowledge. It's not through God or religions. What really defines us is to use scientific knowledge to achieve our goals, to live longer, to live better, and to live with more justice. So that's aspect number one. Science is the toolbox of the current civilization. And that's something that we've been seeing recently in 2 episodes that require from science and that require action from science, and science has been responding. We've been seeing 2 dramatic episodes, which is the issue of the environment that impacts us all. And what we're seeing in Glasgow is something that crisscrosses civilizations and will either join hands around this purpose or will all perish. And the fight against COVID. These are 2 dramatic challenges to health, to wealth, that we have to face, and we have been facing with scientific knowledge. So justice today is equivalent to applying science to all. This is what being just is about. And the prolongation of life for everyone by fighting pandemics and the greenhouse gas effects and the climate change. So you see, we are living in an era where we'll either advance through science or we will not survive. And health and medicine have a decisive importance in that regard. The Constitution, and I speak on behalf of the legal area, the Constitution delegates what to do. So there's a constitutional delegation, as it were. And to act constitutionally is to act according to science. So that is my first take-home message for you about the challenges of our current civilization have been demanding almost like a scientific emergency from scientific knowledge, as it were, and that affects healthcare professionals. It affects students. I am part of the Cancer Foundation that was created by Marcus Moraes, and our goal is to attempt to balance out this different characteristic of our age. So I've talked about health. I talked about life. I talked about justice, but I didn't talk about ethics. And this is what I want to talk about now. And in doing so, I am going to design my proposal. And I'm talking about global issues, and Brazil is inserted in that scenario. So now I will bring my feet to reality, to the Brazilian reality. And I'm going to do that by talking about the environment and medicine and the environment. Evidently, this agenda of climate change, this is a global agenda that is highly connected with the Amazon biome. And if I focus on Brazilian reality and on the reality of Rio de Janeiro specifically, along with the importance of Amazon, we have the Atlantic forest biome, which is of even greater importance, I would say, which is where most of the Brazilian population lives. And we're not giving it the due importance to the protection of the Atlantic forest biome. A young secretary from Rio, he was my student, and he's the secretary of the environment in Rio. And he said, well, the thing about the environment is the degraded areas. It's these slums. It's the communities with no water, with no sewage system. And okay, the Amazon, we have to be concerned about it, but the most urgent agenda we should be focusing on is health and scientific knowledge of the places where we live. And we're not giving due importance to this urgency. And this is the basic problem. And I said that I was going to talk about ethics, because the ethics of democracy is to treat everybody equally. That's what our ethics is like. But in health, no one can be different. In justice, no one can be different. We should all be treated equally. So my subject matter, and you probably noticed that I outlined it, and I may be combining science, ethics, and humanities. The ethics of humankind in Brazil today is to fight inequality, above all in healthcare.
And in the results that we have about who were the greatest victims of the pandemic. And the environment, which is a concern to us, is not the environment that is far away from us. Meaning, I think that we need to have an urgent environmental medicine for the least favored populations in Brazil. This is my point. We need to have environmental medicine urgently. And why do I say environmental and urgent? Environmental, because for its majority, at the time of pandemic over the past few years, an area of growth has been created of destruction of the environment. It's 20%. And this is where we need to be. Because diseases come from the lack of sewers, lack of space, a very unfavorable demography, and the diseases, well, we already know about that. Diphtheria, malnutrition, skin problems. All of these, and these are all environmental problems. So they're caused by the environment, and by the way, cities are constituted in terms of our environment, so much so that ethics and means this: how can we, through science and justice, face this problem which is a priority for us? So this is my point. Well, there are some initiatives of society in terms of defense of the Atlantic forest, defense of the biome in the Atlantic forest, but that has not yet become a priority, a health priority for the least favored populations. Skin diseases, a malnourished child has an intellectual performance and school performance that is much lower. So we need we don't have a scientific program for the mid and long term for environmental medicine for these populations. And then I need to explain, and then I will close after that, my final words. I said urgent environmental medicine. Well, we cannot wait, even though it looks like it's inevitable. And that we should build sewer networks, that drinking water should be piped that would create property rights. The Brazil cannot wait. The Brazil is not a Brazil of reform. I don't care for reforms of any government. What I want to know is about the urgent matters, the urgent programs. These people have urgency for life, urgency for health, and you are responsible and you are competent to deal with that. As we say in Pernambuco, I feel very bad because there is installed capacity, scientific knowledge, and leaders available to deal with this problem. And as a native of the state of Pernambuco, I cannot fail but end with by quoting a renowned native of the state of Pernambuco, who somehow talks about the ethics of science and humanity. Rosiska and I know, in our generation, we know very well the pain of these words. We are well aware how painful these words can be and the warning that they carry. Don Elder Camara used to say, we need to discover the second disease of Brazilians, because the first one we already know. That's hunger. And I would add, is inequality. It's the need to live better with better health. Thank you all very much. Thank you very much, Professor Joaquim Falcão. Brilliant words about humanistic thinking, and at these times that are so toxic and so difficult that we are living in Brazil, we need people like you who can speak to us with such clarity and depth. And this needs to be owned by our population, by the political leaders. I think that shortly ago we were ending another block with the FIS week with Neca Setúbal, and she was also saying that we need to end with just saying things for saying and make things happen. In fact, there is an urgency. I had never thought of that. I don't want reform and first the urgency. So which are our urgencies? What is urgent in Brazil? Well, dialogue is necessary. Joaquim Falcão, you know, you are an example of a person working in the legal area with great skill for communication. And more specifically, in terms of building bridges. And you worked with 3 people who are so different, Celso Furtado, Gilberto Freire, Roberto Marinho, such different personalities, and you were able to build through dialogue a possibility of making things happen by a firm purpose. And in your papers, without interrupting you, but I would just like to emphasize right now that we had the first ecology program in Open TV in the world. And the one that lasted the longest, which is Global Ecology. And that show was the initiative of Claudio Savageri and other colleagues, was really a pioneer. And it's worth watching it again. I think that's it. I think it is even considering different thoughts, which is good, diversity of thoughts, we have a unity of purpose. And this purpose of assuring access to life through good health, good education, good housing, this is all that we need in Brazil. And now I would turn the floor to Professor Ricardo Abramovar for his opening comments. Thank you very much, Professor Abramovar, for your kind presence here today. Ricardo, you are one of those figures, as our dear Joaquim Falcão said, you are a humanistic economist. And within those lines of thought that our dear Joaquim Falcão mentioned, do you think we will be able to walk out from the pandemic, from this tragedy that we are dealing with, by building a model of economy that is socially responsible and capable of reducing inequalities in the world? So, Ricardo Abramovar, you're most welcome. Thank you very much, Josier. It's a pleasure and an honor to be here with you, with Joaquim and Rosiska. I admire all of you so much. And I have prepared, and when I saw the title of our panel, and then combining science, ethics, and humanity, I prepared something which is not really a response to the question that you're proposing, Josier, and the question that you ask can only be answered by an affirmation, a statement. If we can't do that, well, so we shouldn't do anything then. And what Joaquim mentioned, this year we are celebrating 75 years since the publication of the Geography of Hunger. So Josué de Castro, chair in the School of Medicine of the University of São Paulo and in its School of Public Health, is going to hold an event on the 75 years of the publication of the Geography of Hunger. And this is a theme that cannot be avoided in Brazil. But for our conversation, I have prepared something that goes around this theme. Why do we need to combine science, ethics, and humanity? Aren't these themes naturally compatible and necessarily compatible already? How can we think outside the parallel departments a science that is unethical? Well, and it doesn't serve humanity. That being the case, it would not just be compatible with ethics and humanity, but society would naturally see it and provide full support to its development. I have made this caricatural description naturally because it doesn't correspond to facts. Since the 17th century, the suspicion against science, which is permanent, not just against Galileo, but also Darwin along the 20 years he took to publish The Origin of the Species. And it's very interesting to hear the podcast 20,000 Leagues, where they tell the story and the writing that Darwin did. It's very interesting. During the 20th century, the fight against science was related to the planetary science, which really killed the science and the German national science during the Nazism. But be careful, it would be a mistake to imagine that science is threatened just by totalitarianism. Denial and scientific negation has gained strength not just under extreme right governments such as Trump and Bolsonaro, but one of the worst events or phenomenon of the current pandemic. It largely responds for the conspiratory theories whose results are the refusal to vaccination and the dignity of defeating the pandemic, even in rich countries with democratic governments, as we are seeing now in the reincidence of the pandemic in the European Union. How can we explain that? How can we explain this resistance to science? One of the great thinkers of the 20th century, the sociologist Robert Merck, showed that even in democracies, science is threatened because it speaks a language that is distant from everyday lives of people, because it touches themes that whose importance people do not understand, because the results of science are not what will confirm common sense. So Martin demonstrates that to face these prejudices, scientists organize themselves in a community that has its own ethos, which consists of sharing ideas, exposing results for specialized criticism, and give up the theories whenever they prove themselves to be insufficient or mistaken, with impersonal criteria to circumscribe errors for what he calls organized skepticism. Scientists, before anything, they are people who doubt. They have questions to ask. Somehow Popper's work is a philosophical, epistemological version of what Merton says. How do I know if a proposition is scientific? There's no magic formula for that. So I choose a proposition, expose it to peers and to their opinion. That's why it's so important to have specialized scientific journals. And this is why it's a crime that is committed against CAPIS. It's a crime when you put someone who is incapable of running an organization such as CAPIS. Science is not about truth and uncertainty. It's about criticism and doubt, but doubt and criticism based on the most advanced and sophisticated knowledge.
The result is that science is always safer the more it is protected in an ivory tower that protects it against the influence of society. And for the Iniciative, that guarantees the ethos that guarantees the independence of scientific production is very important. The attacks that the scientific organizations have been suffering in our country on the part of the federal government require this independence. In the Trump administration, there was also this threat against science. But when it comes to science, ethics, and humanity, that is only a part, albeit important, of the story. And here's where the most interesting part of the subject that was proposed to us begins. After World War II, not only did the concentration camps and the experiences that occurred there, but also with the explosion of the bomb of Hiroshima and the consequence of the risks that it brought about to the entirety of the life on planet and humankind, the advocacy of science took on a very different path than that which consists in strengthening the ivory tower. In the time frame that was generously offered to us, I cannot explain this process, but today, what Merton called the ethos of science and what Porter consecrated in his epistemology received at least two absolutely fundamental supplements. The first refers to the protagonists of science, and the second concerns the objectives of science, the purposes of science, and this is the true ethical issue. The protagonists of science. Who are the scientists? We can no longer treat scientists as neutral subjects, as bearers of what society wishes to know about the world in concrete means. One of the places where science is more developed, which are the American universities focusing on digital revolution. The Silicon Valley, for instance, is a place where scientific knowledge is strikingly impacted by sexism and racism to an extremely large extent. It's not something marginal. It's at the core of not only the way that science is done, but also the result of science itself. Sexism and racism are present in the Silicon Valley, and there's a vast literature about that. The connection between science and companies is absolutely crucial. Who funds science? And what about the funding offered by denialists of tobacco and the tobacco industry? And what about food and ultra-processed foods? And the disastrous effects on human health in the 21st century. Currently, there's been great progress in that direction. Scientists, in order to publish something, they have to show who funded their research and showing that their research is actually independent, placing science in a democratic environment that is fundamental. A professor of Minas Gerais University published an article on science called the Global Citizen Deliberation about the great scientific subjects that affect our lives cannot simply be treated exclusively inside the ivory tower. And with the companies with which the ivory tower has connections with, citizens are increasingly more present in science. The climate convention in France shows the fertility of initiatives by which citizens question scientists about the phenomena that they relate to, the control of citizens over what science does. For instance, when it comes to personal data protection, in light of the digital revolution and medicine, the specialty to which Josier is a pioneer in Brazil, that's increasingly more important. Contemporary medicine is supported on 4 pillars. It's personalized, preventive, and it is participative. It's not a pure formality that when you're at a hospital, the nurse will say everything that you are going to be given as a treatment. But not only that, the use of personal data to advance with medical research is a very important subject that is being discussed with citizens under risk of us submitting ourselves to situations where our personalities and subjectivity will be impacted. It goes beyond that. We have NGOs today discussing science and members of NGOs publishing in the best scientific journals. And one last aspect concerning who are the protagonists of science concerns what great Edward Cole Wilson at age 87 has been disseminating for the last 20 years, which is the integration between science and humanities. Our biggest challenge today is that the teams that produce scientific knowledge have to be teams that are truly cross or transdisciplinary. And by cross and transdisciplinary, it doesn't mean placing an anthropologist, an economist, and a sociologist together. It's to understand the mistakes made in this interface between humanities, society, and sciences of the earth. More than that, to integrate science with the lores of the peoples from the forest, and integrating science and art. And as a member, collaborator of the Brazilian Academy of Sciences, that is fundamental because it sends an appeal to science. Science should be humble. We should not expose ourselves to scientificism or the idea that only scientific knowledge is valid. As important as it may be now more than ever, it is absolutely fundamental. Artistic knowledge, religious knowledge, the different manifestations of human intellect have to crisscross and irrigate science. The ivory tower has collapsed, and that's excellent news to science. When it comes to goals, since Hans Jonas published the principle of responsibility, talking about the ethics of technological civilization, science can no longer be considered simply as knowledge about the world. Ethics is the discipline of philosophy that studies the purposes and the goals of human science. We need science to help us overcome this fissure between nature and society. Science that is not a science that is there to dominate, as Descartes said, to transform nature and to transform ourselves into masters and lords of nature. Certainly the IPCC reports are moving towards that. And to reiterate what Joaquim Falcão said so brilliantly, we need a science that allows us to overcome this divide between economics and ethics. Science, and I believe that the SDGs are moving also towards that direction. And those seem to be the ways forward to combine science, ethics, and humanities. Thank you. Thank you, Professor. You gave us a wonderful lecture as usual. Before I give the floor to Professor Jessica, a great writer and a member of the Brazilian Academy of Letters, I would only like to mention to Jessica, among the things that Joaquim Falcão mentioned, Ricardo mentioned the Silicon Valley as a very important hub to be observed in terms of racism and sexism that we should not repeat as a reference for the development of innovation and technologies and such things. And currently we talk a lot about the full inclusion of Black and brown people, women, and the LGBT community. And what I see is that we defined that quotas for Blacks and women could be a way to offer them a way to achieve a social ascension. And Francisca, do you think that, in your opinion, quotas are enough, or should we rather build extra doors for increasing the citizenship level of people who are left outside of it from a conceptual standpoint? And do you think it's possible to combine ethics and social responsibility and market economics? So welcome, Rosiska. Thank you very much for being here with us again.
Thank you very much, Josier, for your invitation. Congratulations already for the success of your event, which is no surprise to me, because everything you do is a success. And congratulations to you and all your staff. And to me, it's an honor and a pleasure to be here with you, because it gives me an opportunity, and I am going to somehow reaffirm or repeat your own words, of making a public acknowledgement, which I find is always necessary. It doesn't matter that it is repeated, to all those, and especially the researchers and scientists, researchers, and physicians, and all healthcare workers, and those who were and who still are, because this is far from ending still, that are still on the front lines fighting this global tragedy which happened to us, and which is the coronavirus pandemic. I would like to say thank you precisely to those and researchers who were trying to find the vaccine and were caught by surprise very drastically at a time when science was going through a splendid time, and somehow it believed itself to be almighty. And they knew everything about the cell to the outer space. And there was innovation, questions, there was research, and it transmitted a feeling of omnipotence, a feeling that we can respond to everything or anything with the tools that science provided. And we were caught by surprise, by a mystery, because in the beginning of the pandemic, what we had was just big mystery. Everything was a mystery. No one knew anything. And science was somehow put down from the high place where it was, and like any other mortal was thrown into uncertainty, doubt, fear. Well, everything that I don't need to repeat, and which constituted and still is the experience of this pandemic. And in spite of all of that, science reacted and faced this situation, just like the physicians. They did the same thing, and healthcare workers who also didn't know how to deal with that, or they knew very little about it. And even so, they risked their lives. And they are still risking their lives. And I witnessed a significant loss of some doctors that were my doctors. So I have a feeling of grief for them that is very strong. And I would like to thank them and to thank all of you. On the other hand, I think that there is an important experience for everyone in terms of combining research and humanity. Let's leave ethics for later. Well, but there was a combination between research and humanity. And as I remember, the approximation was so great between medicine, science, and the ordinary mortal person. So what Ricardo put very well has in science a feeling of distance because they do not know what happened in that world. But there has never been maybe such a great approximation and such a great feeling of respect for science and for medicine. And I think that this is a moment that we shouldn't miss. And many questions may be asked of why this is all happening. I would like to use an example which I find important on this debate that has been postulated both by Joaquim and Ricardo about the issue of a democratic ethics for health. And taking the example, I would say that Brazil is a case to be studied because Brazil is precisely at the time or in a situation in which other countries in the world are too. We are not the only one, but there is a wave, a obscurantist wave that is terrible, that increases every day all over the world. So this obscurantist wave doesn't stem out of nothing. And its greatest enemy is science. They dread science, just as they abhor culture and art. But science is our theme here. And taking science as an enemy is precisely due to the fact that science, in the last 50 years maybe, it was more transforming to society than social movements. It even led to society movements, and it transformed the world in such a way, and was transforming the world in such a way that this caused a feeling of insecurity. And this obscurantism didn't come from nothing. It needs to be explained. Why did it appear in this way? And I think that it didn't stem from nothing. It's the best witness of the fear that changes cause. They cause fear, and also this happens especially in the most they have a feeling of insecurity in the crudest groups. There are many repressed ghosts that appear. So the obscurantist fury wants to stop time and history. They want to shut science, to silence science, also to silence social movements. It clings to what is most backwards in religious discourse. I would say that the obscurantism is the visible face of a repressed fear of oneself, maybe, and of what threatens more than anything, which is the freedom of others. Now, one first task maybe right now one of the most pressing tasks is to prevent obscurantism and the fear of the unknown to block the path of science and technological innovation. I would say that blocking science is of extreme severity. It's very grave situation. And Ricardo gave some examples of the destruction of centers of knowledge, which is something that is constant in all such regimes in the world, the destruction of centers of knowledge, research centers, considering research as their greatest enemy. And I repeat, now we are concluding that paradoxically, obscurantism thrives precisely as a direct relationship with the complexity of life. When the progress of science advances, obscurantism advances too. This is one first concern that I have, something that I would like to underline and leave here, is the need to fight by all means obscurantism. This is one point which is fundamental to me. Another thing is the pandemic, and this was also a major discovery, and it was something that revealed, others for the whole world. But somehow it was interesting announced at Davos conference in December 2019, when, to my surprise, and I think to the surprise of everyone that were paying attention to the climate crisis, but then in reporting the major global threats, Davos conference announced that the first number one pandemics that really caught my attention, because we didn't hear much about that. I don't know, except in very specialized cycles or circles rather. But all of a sudden that was top in terms of global concerns, and second was the climate crisis. Now, what happens afterwards, I don't need to say. it was not just science that was taken by surprise, but also populations. Because why do I say that the pandemic is a regulator? Because it revealed immense precariousness just all over the world, precariousness of collective resources to deal with such a big threat. The WHO is maybe the only global health organization, maybe, I don't know, but the one that was the most important. It demonstrated it had scarce resources, no matter how much effort they made. It was poorly equipped to deal with the pandemic. Well, globalization can be described in many different ways. And one of them is the frantic movement of airplanes, huge airplanes with people from everywhere going everywhere in airports that are like cities. And in a bit more than one day, anyone can go around the globe and will take with them your talents, physical features, culture, but also their what is wrong with them, such as a sneeze. You take it too. Globalization is also that. The viruses that have no passport, and then they won't set off the metal detector, are the invisible terrorists, the inevitable illegal immigrants. And they see no borders, they travel unknown, as well as capitals. So they travel freely, the two, the virus and capitals. Well, the pandemic is here. And the world that demonstrated to be vulnerable, very vulnerable. Well, I am saying this because any proposal to better deal with this situation, in my understanding, is going to necessarily come across the ethical issue. And this is not new. In 1948, when Norbert Wiener worked in cybernetics, he said, I am sure that I am introducing a science that can be used for good or for evil, but this is not going to stop. No knowledge goes back, and it doesn't really. And he also added, and he said, well, we shouldn't abandon it.
We shouldn't abandon it because otherwise it will be snatched by the worst ones. Hardly did he know how true that was. But I apply this to every science. And with that, I go back to the subject already mentioned by Ricardo, which is the subject of how we produce science and how we distribute science, which is a subject that is more discussed by Joaquin, who produces science, who funds it, how they fund it. And when you asked me, Jose, to talk about the fact that in the major universities, science is sexist and racist, I think that at least when it comes to sexism, that is certainly true. Otherwise, in Harvard, we wouldn't have had a dean that stated that women were not a good fit for mathematics. So that is so grotesque that it's almost not worthy insisting on that, but it's true. But that also means that everything that was produced as science over the course of history was done in absentia of women, and everything that was about women was produced in their absence. And there's this very interesting book by a psychoanalyst called This Sex, which is not one, referring to one of Lacan's theses, which also refers to the scientific thinking. About racism, well, the response is being provided by the Black initiatives that are becoming increasingly stronger in advocating for the laws of their people, as well as the indigenous peoples. So I wanted to answer your question with this comment, but I'll go back to ethics, which is also one that was mentioned by Joaquin. And you, Josier, about access and this distribution of this filter of human spirit, which is science. I think it's interesting because it was one scientist, Professor Hamburger, a Nobel in biology, a member of the Académie Française, that once said that human rights were the jewel of human thinking, because it was human rights that had taken us, had uplifted us from the condition of being animals. They had created the idea of compassion that nature failed to provide us with natural selection. But I would say that human rights is what Joachim said or called the ethics of democracy. It is impossible to consider in a country like Brazil, for instance, where we try to make it a democracy, not yet completed, but possibly it will be always like that, but we try to make this country a democracy. It is impossible to build that on the basis of an inequality as huge as ours, which is in and of itself an attack against human rights. It's utterly incompatible with human rights. So overcoming this inequality and creating a more solidary country implies, to my understanding, above anything else, a change of values. And this change of values is required because after a certain point, success started being measured practically and uniquely profit. Profit is the measure of success. It's impossible to build ethics and solidarity when your values are exclusively based on profit. And this statement that profit is a criterion of success has relegated ethics to the status of being naive and elevated criminals to the status of being wise or smart. The choices we make over the course of our lives fundamentally depend on what we value. We choose one thing over another depending on what each thing is worth for us. Values are worth for what they are, but according to the mercantile rationale, that is not so. You don't ask what is the worth of something, but rather what is the price of something. The existence of value is easily converted into currency. And I think that when this economic worth trespasses into values in general, a change happens in society, and that's for the worse. And I believe that already happened because societies ruled by this mindset. In these societies, everything has a price, and these societies render invisible anything without a price. And by definition, whatever is free of charge is valueless or worthless. And in that definition, we could include any initiative of solidarity. I'm going to give you an example. There was a dramatic explosion in the south of France a few years ago, and when the GDP was reported, it showed the losses of the company that had exploded and so on and so forth. But the solidarity initiatives were not even considered. So I believe that talking about solidarity and expecting solidarity, wanting solidarity without reforming the ethical values, which are different than simply the rationale of profit, is impossible. So the discussion on ethics should be in every university, in all medical schools, in all schools, in every public discussion. It should be permanently present, not as naivety or as a pious vote, but rather as a need for salvation and to save a world that is moving towards its own doom. I have a book called The Nature of Scorpio, and I named it like that because I said and used to say that we live in a world that follows the nature of scorpions. It would rather commit suicide than be solidary. So we have to change this scorpion-like nature, and that begins with a discussion like the one that we're having here tonight, where on the one hand, we say, like Joachim said, we reaffirm the need to fight this inequality in health at all levels. As Ricardo said, the need for us to produce science that is for the good of humankind and not at the expense of humankind. And this is why I'm saying that profit cannot be the measure of success. It should not and cannot be the measure of success. So these are my remarks, and trying to produce a response to my predecessors, and maybe, Josier, you were expecting me to comment on their talks. I had prepared something different, but you were great as usual. Thank you very much for your huge contribution. And especially based on this warning that Francisca Darcy de Oliveira gave us, I would like for Professor Joaquim and Ricardo to, in 1 minute, leave us with a message of hope, and that one can build a road towards better days based on the warnings that Professor Rosiska gave us. Professor Joaquim, please. Your microphone is off. A philosopher said that time is the master of reasoning. I'm deeply concerned with Brazil that only has a future. I think Brazil should treat everything with urgency. So time is actually the Lord of health and the health of those in need. Thank you. Thank you, Professor Joaquim Falcão. Ricardo, please. Thank you very much for the invitation. It was a huge pleasure to listen to Joaquim and Rosiska tonight. This urgency that Joaquim mentioned reminds me of a remark by Anna Arendt that used to say that we don't have to cultivate a hope. Hope is postponing. We have to act. And she opposed hope to action. And action today starts fundamentally with us getting rid of the fundamentalist fanatism that is currently has currently taken over the capital of Brazil. For as long as that dominates us, it will be impossible for us to have hope. We need to take action. And after taking action, we need to work hard on reconstructing everything, because what these people did to people's heads and souls is terrible, but it will still be studied. So it's all about action. And we have youths watching us, and the youths are giving us the example of action all across the world. Thank you. Thank you, Professor Ricardo Bromavai and Professor Joaquim and Professor Rosiska. I would like to wrap up by saying that your discussions were extremely relevant to all of us. As a physician, I can assure you that medical and hospital services, healthcare services in general, are consumption goods. The difference is that they're consumption goods that cannot be regulated by the laws of market exclusively. The market laws cannot regulate this consumption good, because there are other values, both ethical and moral, that have to be considered in our decision-making process. Thank you very much, and be well, remain alive, because Brazil needs you very much. See you next year. Hopefully, our meeting was great. Thank you. And FIS Week has come to an end. It was truly a wonderful and unique experience with discussions and leaderships, innovation. Yes, you're right. Hopefully you've enjoyed it and learned a lot from all these leaders, and hopefully you've had a lot of fun with us. We had over 21,000 enrollments, over 80 hours of transmission in 3 languages, Brazilian Sign Language, 120 companies, and over 250,000 views. Yes, that's right. And next year, we're going to have it again. As you know, we're going to have 2 FIS weeks, one in May and another in November. In May, we're going to have 4 events. Innova Summit, the biggest innovation event in the healthcare sector in Latin America that you already know of, and comments that we introduced to you in this edition. We're going to have 2 new events: Fiesta Marketing Summit that will talk about things connected to marketing, and the patient experience, and Liga focusing on education. Well, it was a huge pleasure to be with you this entire week, and to have this experience in this incredible FIS week. What happened? Is this a blackout? Where are you all? Hey, production, where are you, Bruno?
Continuem compartilhando a experiência nas redes sociais. Marquem a Iniciativa FIS e utilizem os nossos filtros, que adoramos acompanhar.
Esperamos que vocês tenham curtido muito essa FIS Week. E lembrem de seguir a Iniciativa FIS nas redes sociais para acompanhar todas as novidades.
Mais uma vez, muito obrigada. Nos vemos em maio. Até o ano que vem.